Kamusta? Kamusta? Hala, kamusta? Kamusta kayo? Good morning. Good morning po. Kamusta kayong lahat? Kamusta ang pre-boards one? Madali. Sabi ng mga students ko madali. Ay, miss ako. Sobrang dali. Actually, sabi ng mga, ang feedback din talaga, sobrang dali daw talaga. So next time, masirapan pa natin. Para po namin nagbabasa. Totoo ba? Mahirap ba talaga yung pre-boards one? Parang hindi naman. Parang ako, sinagutan ko ang dali for me. Ang dali, kaya sabi ko, ay, o parang nakatulog na. Well, madali siya in a way, madali siyang hulaan. Totoo yan. Madali siyang hulaan. 'Di ba? Well, your pre-boards one talaga, it's a reality talaga na. Bakit nga ba ganun kahirap? Totoo naman talaga, mahirap mang pre-boards one. Totoo yan. Pero bakit ba siya mahirap? Kasi parang it's a reality check to everyone na parang kailangan nyo mag-double time when it comes to your review. Tapos, meron din kasi may mga chances din na halos wala may mga questions sa board exam na totally hindi nyo talaga alam kung ano yun. Yes, makaka-encounter kayo ng ganun. Naaasa kayo sa, ano ba? Aasa kayo sa context clues. Context clues lang talaga kadalasan yan kapag hindi nyo talaga alam. Okay. Tapos, siguro yun, sinadya talaga namin yun, nahirapan. As in, sinadya talaga namin hirapan siya ngayong board exam. Ngayong pre-boards. Para, alam mo yun, para at least kahit paano yung mga chill-chill na mga people dyan, di ba? Chill-chill na mga tao dyan. Ma-alarm na, shit, mahirap pala. Parang ganun. Di ba? Mahirap pala yung board exam. Kasi may chance talaga, hindi ko alam kung anong lalabas sa board exam. Yung malay nyo, ganyan pala kahirap. Malay nyo, sobrang dali pala niya. Hindi natin sure kung mahirap pa siya or madali. So it would depend on the kasi talaga. On the gumagawa ng exam. Okay. Hindi, pero true talaga, mahirap talaga. Mahirap talaga siya as in. Ako din kahit anong tawag dito, kahit nung inaaral ko siya for the past few days, hindi ko talaga magets yung iba. As in, ang hirap niya all. Let's go for your nursing practice 1. Ako din naman, pre-boards 1 namin nung pre-boards 1 last 2019, November 2019 ako nag-take. Pre-boards 1, NP1. Napapamura na lang talaga ako sa hirap ng tanong talaga as in. Tapos sabi ko, shit, babawi ako ng ng NP2. Yung mga tanong ba naman sa mga derivatives ng estrogen, yun yung mga tanong sa amin noong time na yun. Tapos, nagtawag dito, rarasyo na. NP1 ko 30 over 100 ata, 33 parang ganun. Grabe, ang talaga, as in parang 33 o 30, basta nasa 30s yung scores ko ng NP1. So, relatable talaga yan. Relatable na 30s yung score nyo. Okay, mga ganun yung mga scores nyo. Ano pa ba? Yun, tas naman, syempre magaling manghula ang person. Magaling manghula ang person, nakaka 50-60 ako ng NP2, NP3. Okay? Aabot siya ng 30. Pag maabot ng mga 50-60s, magaling ka manghula. Okay, magaling ka manghula kapag gano'n. Okay? Let's start na. Okay? Meron yung mga heads up ko kayo. Pag dinadaanan ko lang yung tanong, okay? Pag dinadaanan ko lang yung questions, literal binasa ko yung sagot. High chances hindi talaga siya lalabas sa board exam na sobrang hirap talaga niya. Okay? Yung mga iba, tinatry ko mag-extract na what are the expected na lumalabas. For example, yung ganito ang tanong, related sa ganyan topic, mag-i-input lang ako ng mga kasakasal. Okay, para lang hindi kayo ma-overwhelm. Alam kong overwhelm kayo when it comes to the pre-boards one. Hindi nyo talaga siyang intindihan. Okay, para hindi lang kayo overwhelmed. At the same time, may learning kayo. At the same time, meron pumapasok sa inyo na sensitive naman sa board exam. Okay? Nursing practice 1. Nurse Ella is managing the immunization program in Barangay Arandel. Guided by the DOH Manual of Operations, the following questions apply. Okay? Question. Nurse Ella found out there is a high vaccine wastage in the health center. She suspects that the following are the causes of wastage in opened vials except. Anong tamang sagot dito? Tamang sagot. Number 1 pa lang, di nyo na alam sagot, no? Umamin kayo. True. 'Di ba? Umamin kayo dyan. Number 1 pala, napasyet na kayo dyan. Okay? So pag ganito, kapag causes of wastage vials, ibig sabihin niya ito, yung mga bukas na vials, na somatic yan, kapag na-submerge sa water yan, pwede bang pumasok yung water sa loob ng vial? Yes. Okay, X mo yan. Okay. Ito din, the same time, pwede din naman to. Okay? Pwede din yan. Improper reconstitution, yes. Diba? Maano yan kasi open vial naman siya. Correct answer is letter apple. Okay? Exposure to high temperatures are wastage kapag unopened vials. Pag hindi pa bukas yung vial mo. Letter apple. Meron. Ay, may tama. Tama ka na ba? Okay. So ito yung niya, yung mga examples ng wastage mo. Wastage in an open vials, sabihin ito hindi pa bukas yung vial mo, expiration, exposure to heat or freezing temperature, breakage, missing inventory, theft, discarding unused vials from an outreach session. Vaccine wastage in open vial, discarding remaining dose at the end of immunization session, not in accordance with multiple dose vial policy, doses administered below the number of doses indicated on the label of a vial, proper or poor or improper reconstitution practices, open vials submerged in water, suspected contamination, patient reaction requiring more than one dose, administration of incorrect dosage, and few children have showing up during immunization session. Yan ang mga mo. When it comes to the vaccine wastage. Sige, screen cap nyo na lang. Most probably, chances that it won't. May 1 point na ba kayo? May 1 point na? Wala pa. Wala pa. Next. Nurse Elsa computes the vaccine wastage rate, which among the following will she be used to determine the wastage rate? Tamang sagot dito. Ano kayong tamang sagot? It is the number, ano yun? Ano kayong tamang sagot dito? Siyempre mag-C for Christ na kayo, Matic. Letter C. Okay, letter C, doses supplied minus doses administered divided by the doses supplied times 100. Okay? Doses supplied minus the doses administered divided by doses supplied. May tama na ba yung mga person? 1 point. Okay, may 1 point na. At least may 1 point na. Okay? Ano ba siya? So, for example, the total number of doses or the number of doses na ma-supply is 200. And then yung ma-administer is 150. 200 minus 150 divided by 200, the number of total supplied times 100 para magiging percentage siya is equal to your 25%. Okay? 25%. Ibig sabihin nito, 25% of the vaccine supplied to facility is wasted. Pabalik. Pati po sa 1. Babawi ba kayo sa pre-boards 2? Babawi ba sa pre-boards 2 or babawi na lang po ako sa susunod na buhay? Sa susunod, sa next life na lang. Gigil bumawi. Eh paano pag mahirap pa din yung pre-boards 2? Next na, number 3 na. Sa amin na kayo magigigil. Hala ka. Okay. Well, inaaral ko na yung pre-boards 2. So, yeah. Okay. The health center receive. Pangalan sa ilalim. Ano ba yung mga pangalan nasa ilalim? Kasama ba yung pangalan ko dun? Okay. Hala. Gumawa pala ako ng board exam. Charot. Isa ako sa mga gumawa ng pre-boards 1. Yeah. Isa pa ako sa mga gumawa ng pre-boards 1. Sorry na. Dinalian ko na nga yung pre-boards 1 eh. Dinalian ko na nga yung pre-boards 1. Oo, madali na yan. Sabi ko sa inyo. Madali na yung ginawa ko, promise, as compared last season. Last season, mas grabe yung ginawa, mas mahirap yung ginawa ko last season. Ngayon, dinalian ko na. Oo, nasa ano, yung topics ko nasa NP1, NP2. Ano kasi, friends na kami nung Bon, kaya medyo binulungan ko na yung Bon. Okay. The health center received 300 doses of vaccine of this 180 were administered. Mahilig kasi ako sa ECG. So medyo may ECG ako ni pinasok talaga. Mahilig kasi ako sa ECG. Okay, based on the prescribed formula, what is the wastage rate Nurse Elsa will get? Tamang sagot. Ang tamang sagot. So ang formula dito, di ba? 300 minus 180 divided by 300. So 120 divided by 300 is equal to, hindi ko alam kung anong niyan. Basta ang tamang ay 0.4. 0.4 tamang sagot is equal to letter boy. Letter boy, 40%. O tama na ba? Tama na yung tama na. Nakaka 2 points na or 1 point pa din. Or 0 pa din. Okay lang yan pag 0. Okay lang yan. Okay. Next. A nurse is stocking and storing injection equipment in the rural health unit. Okay, 40%. Kapag ganito, 40% are yun na waste. Okay, 40% yung wastage rate. Ibig sabihin niya 40% of the vaccine is wasted. Okay, 40% of the vaccine is wasted. Nurse is stocking and storing injection equipment in the rural health unit, which among the following practices require a follow-up. Kapag require a follow-up, ano ibig sabihin nito? Tama or mali hinahanap mo? Negative. Negative yan. Okay? Ililimit mo ba yung access sa storage area? Ibig sabihin nito, yung authorized personnel lang ang papasok sa storage area? Yes. Okay? Store a flammable products in a separate area? Yes, yan. Oo, yan. Okay, sa mamimili ka, it's either B and C. Anong tamang sagot? Letter boy. Okay, letter boy. Bakit, sir? So, siyempre, dapat yung mga latex products mo, hindi mo siya i-expose sa light. Bakit? Kapag in-expose mo siya sa light, ano mangyayari? Magiging, breakable siya. Okay, madali siyang masira or parang lulutong siya. Yes. So, letter boy. Okay, letter boy. Nurse Elsa is aware that lyophilized vaccines must be stored in temperature within 2 to 8 degrees Celsius. This vaccine include the following but. Kapag but ulit, sabihin ito, negative hinahanap mo. Okay, negative ulit. Ano kaya ang tamang sagot dito? Tamang sagot, letter, kaya letter dog. Okay, letter dog, your hepatitis B vaccine kasi is what? Freeze-dried or freeze-sensitive vaccine. Okay, it is a freeze-sensitive vaccine. Okay, ano ba yung your lyophilized vaccines at positive 2 to positive 8 is your BCG, Japanese encephalitis, MMR, and MR. Your free sensitive vaccines are your Hep B, IPV, Penta HPV, flu, PCV, Rota, TD, and your tetanus toxoid. Okay, tetanus toxoid. Ano, kadalasan tanong po sa board exam, ano bang vaccine ang dapat nasa freezer? Anong vaccine lang dapat ang nasa freezer po? Ano kaya yung mga yon? Your ano yung sabihin ng VOM? Your, ano yung sabihin letter? Varicella, ano pa? OPV, MMR. Okay? Varicella, OPV, tsaka MMR. So anong tamang sagot dito? For sure. The Electric Corporation supplying the RHU announced that there will be power interruption in Barangay Arendelle. Nurses also should be concerned with which among the following vaccines. Tamang sagot dito. Tamang sagot is letter apple. Apple. Charot. Letter dog. Oral polio vaccine. Okay? Letter dog. O, kinabahan kayo dyan. Akala nyo letter A. Letter dog. Okay, letter dog. Okay, letter dog. Alam ko na yung mga reaction nyo dyan. Okay, letter dog. Wala ka nang ginawang tama. Okay, ano ba yung proper arrangement mo? So una dyan is your OPV. Okay, OPV, meningococcal conjugate vaccine, your BCG, and your IPV. Again, ang pinaka-sensitive mo is your OPV, your meningococcal conjugate vaccine, your BCG, and your IPV. Ano ba yung proper arrangement niya? Ito po. Yes, sa board, alam nyo, you expect nyo yung mga yung mga hindi na-expect na lumalabas sa board exam. Di ko lang sure kung naturo na sa inyo. For example, nung board exam ko, ang lumabas sa amin nung board exam ko is the type of ref. Ref for VC, for vaccines. Okay? Ref for vaccines ang lumabas ng board exam. Yes. Okay. Hindi type of ref, like dorm type ref. Ba, ano pa yung chest type, chest ref, chest something chest type freezer ref ba, ganyan. Ganyan yung mga. Number ano ba? Anong number? Ito. Basta ayaw mo ng dorm type na ref. Ayaw mo ng dorm type ref. Sensitive sa vaccines, ito. Yung ref dapat, wait. Ang appropriate ref mo, nandito yun sa ano kay. Hindi kasi ako nag-CHN ngayon. Basta hindi siya dorm type. Hindi siya dorm type na ref. Tapos dapat hiwala yung freezer. Tsaka hiwala yung freezer. Tsaka yung regular ref. 2-door siya dapat. Hindi siya yung 1-door lang. Yeah. Mga ganyan, promise may 1-door, may 2-door freezer type of ref. May mga ganun na tanong sa board exam. Noong time ko. Okay. Wait lang. Wait lang, 5 minutes lang. May emergency lang. Wait lang. Sorry. Tumawag lang ang aking research coordinator. Okay, next. Next is when computing. Ang reference maganda masabi about sa vaccine, WHO and CDC. Okay, WHO and CDC pinakamaganda. Okay. WHO and CDC. Number 5. Ano kasi siya, you're differentiating if it is a free tawag ng free sensitive or lyophilized vaccine siya. Okay. When computing for the supply requirements for vaccination including syringe and needles, the wastage factor recommended by the DOH is ano kaya? Letter So ang hinahanap natin is wastage factor. Your wastage factor is letter apple. Okay, letter apple. The wastage factor given for immunization supplies to avoid shortage is set at 1.11, which is equivalent to the 10% of wastage factor. Okay, wastage factor. The wastage factor is used for estimating the needs for AD syringes, mixing syringes, and safety boxes. Letter apple. Letter apple. Yes po, except. Yeah, Hep B nga. Yeah, Hep B kasi your letter A, B, C is your lyophilized vaccine. Your letter dog po hepatitis is a free sensitive vaccine. Okay, free sensitive vaccine kasi siya. According to the WHO multi-dose vial policy, the following statement is correct about the non-WHO pre-qualified vaccines except. So, anong tama kayong sagot dito? Except, okay, the vials must be discarded at the end of the immunization session. Yes. Okay. Open vials have no scene breakage. Yes. Okay. Ang tamang sagot dito, okay? Tamang sagot dito, yung mga vaccine products mo ba siya after 28 days ba siya or after 6 hours lang? Ano kayong tamang sagot dito? Letter except ang hinahanap natin. So syempre gusto mo ba nakabukas ang vial mo for at least 28 days, almost 28 days? No. Okay, letter boy. 6 hours lang. Okay, 6 hours lang yung maximum mo. Okay, letter boy. Okay, letter boy. Next, a nurse in charge of caring for ice packs to be used in cold chain management. Which among the following actions will be required for follow-up? Ngayon, tamang sagot nito. Okay. Letter boy, there is no need to refill ice packs after every use. Use the same water repeatedly. Yes. Okay, hindi ka po nagpapalit ng ice pack pag nasa ref po. Okay, so pwede to. An ice pack is adequately conditioned as soon as beads of water cover its surface. Yes. Okay. Refrain from using vaccine ice packs to transport specimens to the laboratory. Kasi specimen to, hindi naman vaccine. Yes. Correct answer is letter apple. Okay. Dapat po, when ice pack conditioning, remove ice packs from freezer and allow temperature to rise to 0 degrees Celsius. Okay, 0 degrees po dapat. It's not -5. Okay, 0 degrees Celsius. Ikaw naman. 0 degrees Celsius. Yan. Okay, number 9, letter apple. Apple. Next na po. Paano pala kayo nag-pre-boards? Face-to-face yung pre-boards nyo. Face-to-face yung pre-boards nyo. So feel na feel yung magbo-board exam. Tapos pagka ang hirap ng exam. No. Yellow. Ito yellow yung ano font. Okay, sige, yellow ko na. Hindi ko matandaan paano pag minamis na shadean. Ako ang ginawa nung board exam ko kasi. May magagalit syempre na student. Nung board exam ko, nagbura kasi ako nung board exam ko. Pasaway kasi ako. Okay, pasaway kasi ako nung boards. Kasi meron kami nung Scantron Day. Hindi ko lang sure kung may Scantron Day pa kayo. Parang ano, ginawa namin, nag-experiment kami ng mga kabatch ko. So, ginawa namin, nag-try kami, from 1 to 10 items yun. Nasinada namin, tapos binura namin, binago namin yung sagot namin. Nababasa naman. So, parang nagbura pa din ako. Okay, pero kadalasan talaga 2. Tapos at the same time, 2 hours po ang board exam. O, 2 hours. Kaya nung board exam, nagbura ako nung board exam. Pasaway na bata. Pero di ba sabi ng mga lecturer, wag daw magbubura. Di ba? Wag daw magbubura. Ayun, pero ginawa ko nun, ginawa ko lahat ng type ng pag-shade. Ginawa ko yung hindi siya buong buo. Meron naman sobrang sobrang diin naman. Wala naman siya. Safe naman. Okay? Nakaka 100 nung Okay. Nurse Elsa is teaching a student nurse in the community about storage of vaccine. Which among the following vaccine, if placed in the freezer by the student, will require further intervention by nurse? Elsa, anong tamang sagot kaya? Ano kayang tamang sagot dito? Letter Apple. Okay, letter Apple, pentavalent vaccine. Okay, pentavalent vaccine. BCG pwede din siya. Pero kasi, ang BCG vaccine, ang nangyayari dito, hindi nasisira yung pinaka-BCG na vaccine itself. Ang nasisira kasi yung ampule. Okay, so mas tamang sagot pa din si letter Apple. Okay, si letter Apple pa din po. Letter Apple pa din. Evaluation phase of nursing process is a planned, ongoing, purposeful activity that determines the client's progress towards achievement of goals. The following questions apply. Okay, the focus of evaluation in the care of individuals are the following except isang araw lang kayo nag-pre-boards. Sakit sa ulo. Sakit sa ulo hanggang gabi. Tapos lugmok na lugmok kayo. Kasi ang hirap ng pre-boards 1. Di ba? Lugmok na lugmok kayo, tapos natatawa na lang kayo. Di ba? Feeling nyo parang, shit, ano bang ginawa ko sa buhay ko? Okay, di ba? Okay, the focus of evaluation in the care of individuals are the following except, okay? So ang focus mo in evaluating care of your individual is your quality of life, yes, patient satisfaction, compliance measures, and your impact of your educational interventions, not the medical interventions. Letter C. Okay, letter C. So ba yung gano'n to? Ganyan na color? Anong gusto niyong color ng font? Ay, ng ganyan? Parang sakit sa mata. Darker. Red na lang. Ganyan. Ganyan. Ganyan Okay, educational. Interventions. Yan. Yan ang mo. The focus of evaluation in the care of individuals are the following except the impact of medical interventions. Kasi dapat educational interventions. Okay? In 3, 2, 1. When formulating outcomes of a community health program, the following aspects are considered by the nurse aside from, tama or maling sagot hinahanap mo dyan. Pag aside from, mali. Okay? Maling sagot yan. So, hinanap mo ba yung impact? Yes. Okay? Outputs? Yes. And effects. Okay, ito siya. Letter boy. Okay, letter boy. Ano ba yung sabihin ng output? Ang output mo yung sabihin ito, meron kang specific products. Okay, specific products or services. Okay, specific products or services. Ang effect mo naman are the result of your result of the use of your project outputs. Yan siya. Your impact, tandaan nyo lang siya, kadalasan ng impact mo, ito yung long term. Okay, long term program effects. Okay, outcome, program effects, and a broader and an expression, wait lang, of broader long range program objectives. Yan siya. True. Okay, yan siya. Yan yung mga mo. Letter boy. Sige, kopyain nyo muna. Yan yung mga ganyan. Pwedeng lumabas sa board exam yung mga ganyan. Pwede, pero not high chances. Pwede, may chance lang siya. May chance. May chance. Minsan pag next na. Okay, next. Which among the following can be categorized of your output? Kapag output of your community health program that involves the development of barangay health education campaign tuberculosis. So we are looking for the output. Kapag output, anything that is tangible. Okay, tangible. Sabihin na hawakan. Ano kayong tamang sagot dyan? Ano dyan? Letter dog. Okay, letter dog. Ano yung letter apple? Ang letter apple mo, transferring of knowledge. So kapag nagta-transfer ka ng knowledge, nag-i-input ka. Okay, nag-i-input ka. Input. Okay, so ang pansinin nyo dito, a gradual decrease in the number of cases of tuberculosis in 2 years. So long term. Kapag long term, that is your impact. Impact yan. Okay, impact. Tapos yun mo, there's an evident increase in the knowledge that is, ano bang ginawa mo? Nagbigay ka ng visual aid. So magkakaroon sila ng increase in knowledge. Ang tamang sagot sa letter C is the effect. Okay, the effect. Okay, effect. So number 14, anong tamang sagot sa number 14? Which among the following is the effect? Effect letter. Oh yeah. Letter cat. Okay, letter cat. Letter cat. How about your input? Input mo is letter apple. Letter apple. Letter apple. O may score, may mga scores sa ba mga person? At least naka-ano na kayo. May naka-ano na ba? 15 over 15. May naka-15 na ba? Si Cha, ang galing mo naman. Okay, next. Ay, 14. Ay, ikaw na matalino. Community health nurses must be equipped with knowledge and skills prioritizing community health problems using a set of criteria. The following questions apply. Okay, which among the following criteria? Na 14. Talaga nga naman. Kaya lang, mabait naman tayo. Is used in community health nursing but not in the family health nursing. Ano kaya ang tamang sagot dito? Ano kaya? So, syempre, okay, kapag community health nursing na the nature of the problem, magnitude of the problem, preventive potential, and your social concern. Okay, and your modifiability. Correct answer dito is letter apple. Severity of the problem. Letter apple. Okay, letter apple. Ano bang difference when it comes to community health nursing and family health nursing? Si community health nursing, meron kang nature of the problem, magnitude of the problem, modifiability, preventive potential, and social concern. Okay? Your family health nursing, nandyan si nature of the problem, nandyan yung health deficit, health threat, ano pa ba, foreseeable crisis and wellness condition. Modifiability, preventive potential. Ibig sabihin ng preventive potential, yung future, kumbaga, pag na-address mo to, yung mga future problem ma-address din. And your salience. Ang salience nito, ibig sabihin ito, nakikita ba ng family mo something na may problem doon? Okay? So wala kang magnitude of the problem or the severity of the problem. (17) If the percentage of population affected by a certain disease in the community is 45%, the nurse will place which score under the criterion of magnitude of the problem. Okay? So ang scoring mo dyan, kapag 4 is equal to your 75 to 100%. Okay. Pag 3 naman, ang percentage mo dyan is 50 to 74%. Kapag 2, ang scoring mo dyan is 25 to 49%. Ang 1 po is equal to your less than 25%. Okay, ano ba ibig sabihin nito? This is your magnitude of the problem. Ang tinetest mo kasi dito is the percentage. Okay, percentage of people affected by the problem. Correct answer is letter boy. Letter boy. Letter boy. $25. Sorry na, 25. Oo nga. 25. Ay, na-discuss sa inyo to. Na-discuss sa inyo to. Na-discuss sa inyo nung manghula. Akala ko naman kung ano. Hindi nag-a-apply yan, di ba? Ang nag-a-apply parang lowest, tanggalin mo yung lowest, tanggalin mo yung highest. Yung second to the highest ang sasagutin mo. Di ba yun? Hindi. Yung may ganung technique. Di ba? Yung ganun yung technique. Okay. Siyempre yung mga ganyan ginagawa ko, hindi yun yung ginagawa ko pag nagumagawa ka ng pre-boards. Okay. Ito yung mo. Ito yung scaling for the community health nursing problems. Okay. So kapag nature of the problem, nandyan si health status, health resources, and health related. Si magnitude of the problem, nandyan si yung people affected. Modifiability, preventive potential, and your social concern. 2, kapag urgent community concerns and readiness. Diba? Kapag 1 naman recognizes a problem, but not needing urgent attention and not a community concern. Sabi sa akin kapag done, gawin sa Republic Act. O yung Republic Act. Ang Republic, wala, noong time namin, ang Republic Act namin, Blood Donation Act. Kwento ko ba sa inyo, nung board exam ko, isa lang yung RA namin, Blood Donation Act. Tapos, hindi pa tinanong kung anong RA yun. Anong laman ng RA? Okay. Next. Yeah. Yun yung mga tinatanong. Swerte nyo na lang kapag tinanong mismo yung pinaka-RA. Next. A high preventive potential sa raw score of, preventive potential lang high dyan is 3. Letter apple. Letter apple. Habig sa inyo, there would be time talaga na sa board exam, kailangan matanggap nyo talaga na may mga tanong sa board exam talaga na hindi nyo talaga alam. Oo. And parang kapag ganun, move on. Kasi most probably, ang dami mong alam na tanong dyan. Okay? Ang dami mong alam dyan. Move on kapag hindi mo alam yung sagot. Move on ka. Oo. Move on. Kasi most probably less than 10 items yung yung hindi ka talaga familiar. Okay, yan ulit yung Next, the nurse. Yeah. At least ngayon, 'di ba, mas madami kayong hindi alam. 'Di ba? Kaysa yung madami na kayong alam sa board exam. Hindi niyo siya alam. The nurse held a town hall meeting with the residents of the barangay. Majority of the people expressed their urgent concern about the prevalence of the parasitism and many are willing. So, ibig sabihin nito, aware na sila. Okay, aware sila. At the same time, gusto nila may gawing action. The social concern is, anong score mo dito? Di ba? Kapag 2, sabihin niyan, aware sila, at the same time, ready sila for action. Kapag 1 naman, aware sila sa problem, but hindi sila nagre-require or hindi pa sila ready for any action. So, letter boy. Letter boy. Tama, yung sagot. Tama kayo dyan. Next. Ay, ang galing. Sabi sa inyo, ang NP1 ang pinakamataas ng score, kadalasan. After a comprehensive community diagnosis, the public health nurses identified multiple health problems in the community, which among the following are considered your health-related problem. Okay, tandaan nyo, kapag health status, it is about what? Your mortality, morbidity, and fertility. Okay, kapag health status, again, it is about your morbidity, mortality, and fertility. Your health resources problem are about the manpower, money, materials, and institutions. Okay? Yan ang iyong health resources, and health-related, it's about your social, economic, environmental, and political factors. Okay? So letter apple mo, ano yung letter apple mo kaya? Ano yung apple mo? Status, very good, health status. Letter boy mo, yung letter boy. Letter boy mo, health status din to. Okay, health status din to. Your letter C, it is your resources. Okay, resource. Tamang sagot, letter dog. Letter dog. Letter dog. Okay, next. Nurse Frodo is studying epidemiology because he will apply these principles when implementing care to the people of Barangay Mordor. The following questions apply. Which among the following statement is considered true about the sensitivity and specificity of the test? Okay. Sensitivity is the proportion of people without the disease who test negative on the screening test. Ang sensitivity mo is about the people with the disease, okay, with the disease, with yan, who test positive, okay, who test positive. That is your sensitivity. Okay, that is your sensitivity. Sensitivity measures the probability of test correctly identifying the positive cases. Kaya hinahanap mo ang true positive. Okay, you're looking for the true positive. Specificity is the proportion of persons with disease who have positive results on screening tests. Ang specificity mo naman, negative results ang hinahanap mo. Okay, tamang sagot, letter dog. Okay, tandaan nyo, ang sensitivity na hanap mo si true positive. Okay, true positive ang sensitivity mo. Okay, true positive ang hinahanap mo dyan. Si specificity mo, yung mga the true negative. Kumbaga, okay, si sensitivity, hanapin mo, or nag-screen ka, hanapin mo doon kung sino ba kung gaano ba ka-sensitive. Sabihin ito kung gaano ba ka-reliable isang test mo para makadetect siya ng mga positive cases. This is your sensitivity. Maglagay natin with positive. Sabihin sa akin pagtapos na mag-screen cap. Done na po. Opo, in 3, 2, 1. A patient is being tested for tuberculosis using your DSSM. The result was negative. Okay? Further test using your expert MTB showed a positive result. Your MTB Gene Expert is your gold standard. Okay, gold standard when it comes to your pulmonary tuberculosis. Nurse Frodo will correctly imply that DSM Dan has sabihin hindi niya na-detect yung true positive case. Okay, mataas or mababa ang sensitivity niya? Mataas, mababa ang sensitivity, hindi niya na-detect. Low, letter C. Okay, low kasi hindi niya na-detect kung meron bang sakit or merong positive case si patient. Pero si MTB Gene Expert, mataas or mababa ang sensitivity niya? High or low sensitivity? High sensitivity ang MTB Gene Expert mo. Kasi nakaka-detect siya ng person na merong pulmonary tuberculosis or tuberculosis itself. Letter cat. Letter cat. Number 23. Which among the following statement is correct about the susceptibility and immunity of the community against a disease? Okay, herd immunity is the basis for determining the reaction of individual against invasion. Di ba? Ang herd immunity is about the community, yes or no? Herd immunity is about community, yes. So dapat, correct ang hinahanap mo. Mali to kasi dapat population to. Population yan. Or community itself. Okay, an endemic occurs when there's a proportion of susceptible are high compared to the proportion of immune. This is your epidemic. Epidemic to. If there are low numbers of immunity, it is an endemic. Okay, endemic. Again, ito endemic. Epidemic. And this is your community. Tamang sagot, letter apple. Ano ibig sabihin ito? Immunity level is inversely proportional to the susceptibility level. So kapag mas mataas ang immunization level or immunity level nila, mas higher chances ba magkaroon ng sakit yung mga tao? Mas lower. Mas lower yan. Diba? Pag mas mataas ang immunity level, mas lower ang susceptibility nila. Pero kunwari mababa lang ang immunity level nila, kamusta yung susceptibility nila? Kumbaga, kamusta yung hawaan nila dyan? Mataas. Okay, mataas. So, letter apple. Okay, letter apple. Diba? For example, a good example niyan is yung COVID vaccine. Diba? Yung target ng government is herd immunity. Di ko sure kung na-meet yung herd immunity natin ngayon. Di ko lang sure. Parang hindi ata. Pero ngayon, ang tendency nito, lower cases na. Okay, lower cases na siya. Okay? Kasi nangyari, mas less yung mga taong tinetest. Kaya lower yung cases. So letter apple. 24. In analytical epidemiology, risk estimates are used to measure the association of risk factors to a particular disease, which risk estimate is used of Nurse Frodo wants to determine the impact that programs might have in reducing problems. Okay. Odds ratio and relative risk ratio is almost the same. Are used to what? determine the probability of disease upon exposure. Okay, to determine of the probability of disease upon exposure to a risk factor. Tamang sagot dito is letter dog. Okay, letter dog. Ano ba yung letter dog? Determines the absolute effect of exposure to the disease. Okay. Absolute effect. Sabihin ito, most probably. Okay. Hindi mo siya yung absolute effect as compared to your odds ratio is the probability. Itong attributable risk is the absolute effect. Letter dog. Letter dog. Even ratio, invento lang yan. Okay, invento lang even ratio. Sabi sa akin kapag next na. Kaya pa. Kaya pa yan. Alam niyo, pansin ko pag pre-boards 1, tahimik yung mga estudyante. Pansin ko yan. Pansin ko yan, lalo na pag pre-boards 1. Tapos kumari medyo, yung sobrang lalim ng mga tanong na, walang sasagot dyan. Tapos, wala din kahit magtatanong ako anong tamang sagot, wala talaga. Oo, pag pre-boards 1, wala nga talaga. Promise, expected yun, and expected yun. Okay, Nurse Frodo is reviewing the probability, context clues kayo kapag probability. Okay, kapag probability, ano other term for your probability of contact between the source of infection and the susceptible host? Nurse Frodo is analyzing what aspects of your epidemiology. Okay, tamang sagot dito. Di ba? Context clues tayo dito, letter apple. Letter apple, chance. Okay, probability kasi, di ba? Ang probability mo, other term dyan, pwede siyang chance. Okay, pwede siyang chance. Okay, ano yung exposure? Exposure mo is the opportunities to transfer the infection to a host. Okay. Yan. Letter dog. Letter dog. Nag-ano kayo sa possibility. Ano yon? Yung possibility kasi ano lang siya. Pampalito lang. Okay. Letter apple. Ano kasi pag ganyan, masyado na madaming letters, mag-letter A naman kayo pag ganyan. 'Di ba? Masyado madami na yung letter C sinagot nyo, mag-letter A naman kayo, B. Next. Nurse Isa is assessing community health needs of Barangay Reid. The following questions apply. This approach to a community health diagnosis recognizes the fact that health status of the community is a product of various interacting. Kapag interacting elements such as your population, 'di ba? Physical characteristics and socioeconomic factors. Sa biology, ano yung sabihin ng interacting elements? Ecosystem ba to, yes or no? 'Di ba? Kapag pag medyo medyo desperate move na. Pag nasa biology kayo, ano yung interacting elements? Ecosystem 'yun, 'di ba? Ano yung malapit sa ecosystem diyan? Letter ano kaya? Letter boy, ecologic approach. Letter boy. Letter boy. Number 27, according to Freeman, community health diagnosis is based on the three interdependent, interacting, and constantly changing conditions, which is not included. So, syempre, your three interdependent, interacting, constantly changing conditions is number 1, community health capability. Yes. The health status of the community. And the community action potential. Community action potential, letter dog. Okay, letter dog. Itong tatlo yung in-identify mismo ni Freeman. Letter dog. Letter dog. Number 28. Nurse Isa considers that the socio-economic and cultural values that are essential in assessing community health needs, which of the following is not included? Or we are looking for the, pabalik sa 26. Layo ko naman ito, 26. Nurse Isa considers the socioeconomic, cultural values that are essential in assessing community health needs, which among the following is not included. Kaya, we're looking for the socioeconomic variables. Okay, socioeconomic and cultural variables. Tamang sagot dito is letter, letter, kanya-kanyang letter dog. Okay, letter dog, sources of health funding. It is under your health resources. Okay, under your health resources, your letter A, B, and C is under your socioeconomic variables. Okay, socioeconomic variables. Letter dog. Napapansin ko, ba't wala yung tamang sagot dito sa mga to? Letter dog. Okay, masyado na daw madami ang letter C nyo, D. Okay, masyado na daw madami. Letter dog. Which among the following factors is categorized under your health resources? It's not categorized under your health resources. Wait lang, wait. Sorry. Not categorized under health resources. Ano kayang tamang sagot dito? Letter, manpower, yes. Di ba kayo na manpower, health institution, and hospital bed ratio? Tamang sagot, letter C. Letter C. Yan na, letter C na. Tama na ba yung sagot nyo dyan? Sino yun? Tama na. Letter C. Plus 1 point. Letter A, sir, sagot ko kasi sa 1 ako sa letter C. Sad life. Okay. Nurse Isa started the data collection phase. Which among the following data collection will she consider the list? Tamang sagot, list. Ibig sabihin pinaka-ano mo dyan. Sabihin nyo, hindi pinaka-objective mo dyan. Siyempre magbabarangay records ka ba? Review of your barangay records. Yes or no? Yes. Mas reliable to. Reliable to. Interview of the people. Yes. And focus group discussion. Bakit, Sir Marie, yung letter A? Nagawa naman namin tong letter A. Kasi ito, ano ba nangyayari? Di ba ang tendency mo dyan, lakad-lakad ka lang? Maglalakad ka, nagkikipag-usap ka ba kapag windshield survey? Ano ka ba? Ano ginagawa mo dyan? Para bang observe ka lang. Di ba nag-observe ka lang kapag ganyan? Wala kang kausap. Hindi mo kakausapin yung community mo. Okay? So ang gagawin mo lang dyan, for the observe ka lang, hindi mo alam kung anong reason kung bakit ganyan yung kalsada nila, bakit ganyan yung mga wiring nila, 'di ba? So ang dito kasi, data collection method with she considered the least. Ibig sabihin ito, lahat sa importante, pero yung mo lang sa ano ba yung hindi pinaka-objective dito, yung wala ka masyadong makukuha data. So letter apple. Okay, yes. For the judgment lang, titingnan mo lang kung kung panay lubak ba, madami bang humps, madami bang, ano ba kadalasan yan? Yung tubig ba nila maayos? Diba? Ako pinakaayaw ko din yan. Ang hanap ng pogi. Totoo yan, mga o kaya bibili ng soft drinks sa tindahan. Umamin kayo dyan, gagawin nyo yan, bibili ng soft drinks sa tindahan. O kaya, may mga kadalasan, bili ng fishbowl, totoo. Tapos pagkabalik, meron ka na dala-dalang soft drinks sa plastic. 'Di ba? Pero hindi naman nagawa yung windshield survey. Babalik ka na lang. Next. Uy, grabe naman, nagka-jowa kayo sa committee. Ang lala naman. Grabe naman. When collecting data, Nurse Isa knows that questionnaires must be prepared in advance. If she includes all of the possible answers that response may give, she's using which of the following? Tamang sagot dito. Ang tamang sagot dito, yung fixed response, okay, ang fixed, dito kasi, di ba? Ginawa mo kasi dito, context ulit tayo. She includes all possible answers that respondents may give. Okay? Yung fixed response, ito yung isang tanong, isang sagot. Okay? Kumbaga sa survey, only one response per question. One response per question. Yan siya. Sorry. Matipid. Yes. Yung mutually exclusive choices, ito yung mga hindi nag-overlap. Do not overlap choices. Okay? Ang nilagay mo kasi dito, includes all possible. Ano bang ginagawa? Nag-exhaust ka ba? Yes or no? Nag-exhaust ka ba? Yes. Letter dog. Okay, letter dog. Letter dog. Letter C, invento lang. Okay, invento lang yung letter C. Okay, next. Nurse is about to present the findings. The findings of her data collection to the barangay council. If she would like to present correlation of two variables, okay, two variables, which among the following graphs should she utilize? Akala mo yung letter D yung invento. Okay, two variables. Okay, ang histogram frequency polygon, multiple. Okay, multiple variables that is quantitative. Okay, multiple variables that is quanti. Okay, quanti yan. Yung bar graph mo naman, it is about your categorical data. Categorical data. Your line graph naman, quantitative data that is interval. Correct answer is letter boy. Okay, letter boy. Dito papasok sila negative correlation, positive correlation, no correlation. So letter boy. Letter boy. Two variables kasi siya. Letter boy. Letter boy. Ganito yung itsura niya. Ayan. Okay. So, two variables. Ito si variable X, si variable Y. Okay. So, titingnan mo kung may positive correlation, negative correlation, or no correlation at all. Next, Nurse Patpat is performing assessment of a family in Barangay Lilac. First level of assessment involves gathering 5 types of data which generates categories of health condition. Nurse Patpat must perform the assessment in what order? Tamang sagot. Ano unahin mo? Ano kayang unahin mo dito? Favorite, ay isa to sa pinakaayaw ko pag family health nursing. Yung interview na napakahaba-haba. Ano kaya? Ang una mo dyan, ano unahin natin dyan? Family structure. Okay, family structure. Tapos your socioeconomic, cultural characteristics, home environment, health status of each member, and the values and practices on health promotion. Letter cat. Letter cat. (34) All of the following statements are correct about the first level of assessment of a family except, okay, data about the current health status is. Okay, health status kasi to. Diba? Ang problems identified include health threats and health deficit. Yes. Specific health conditions. Yes. Okay? Yung letter boy mo kasi it is under your secondary or second level of assessment. Di ba? A good example nito, for example, health parasitism as health deficit due to inability to recognize the problem. Ang first level of assessment mo is this one. Ito siya. Okay? Etong due to inability, it's a family health task na kailangan magagampanan nila. This is your second level of assessment. Okay, your second level of assessment. Ayan siya. First. Second. Slides. Mawala slides in 3, 2, 1. Ito siya. Yan ang first level versus your second level of assessment. Amen. Yan yung mga possible na lumabas sa board exam. Okay, mga possible na lumabas sa board exam. Next. Saan to nakuha? Maglaya book. Sa Maglaya siya. Nurse Pat Pat is guided by theoretical frameworks when working with families in their care, which among the following is consistent with the principles of family systems theory. Okay, family systems theory, tamang sagot dito. Okay, letter boy is a symbolic interaction. Symbolic, interactional yan. Your letter C, it is a structural, functional. A structural, functional. Your letter dog is your developmental approach. Tamang sagot, letter apple. Letter apple. Letter apple. Letter apple. Sabi sa akin pag next na. Next. This diagram can be used by Nurse Pat to visually represent the family interactions or relationship with external environment and its resources. Tamang sagot, visually represent the family interaction, okay, with external environment. Siyempre, sure na sure yung mga people dito, your echo map. Okay, ano yung genogram? Ano yung genogram? Ano yung genogram? Family, medical history. Okay, medical history. Family medical history yan. Your problem 3 discusses about your cause and effect. Okay, cause and effect. Your proceed model is something about your health behavior. Health behavior. Kadalasan sa CDX to nag-a-apply, sa community diagnosis mo nag-a-apply ang iyong proceed model. Letter apple. Number 37. Nurse Patpat is performing a second level of assessment of family. Which among the following family nursing problems will she identify if one of the member or the family members has been bedridden for 5 years and already has caregiver role strain? Okay. Tamang sagot dito, o kapag meron sakit, makakapagbigay pa ba siya ng care, yes or no? Pag may sakit, no na. So letter dog. Okay, inability to provide adequate nursing care. Okay, letter dog. Tama dito. Tama. Yes. Parang mataas naman ata yung mga scores nyo. Which among the following nursing problems will Nurse Patpat identify who has AIDS, is ostracized by neighbors, and express feeling of alienation which hindered his ability for health management? Ibig sabihin ba nga nito? Ang sabihin ba nito? Feeling ko lang. Ibig sabihin ba nito, ang ganitong problem, para magiging alienated siya, ma-utilize ba niya yung community? Yes or no? Kasi may judgment eh. Diba? Kadalasan niya, hindi niya ma-utilize. Letter, anong tamang sagot? Nandun na yung sagot, letter boy. Failure to utilize community resources for health care. Kadalasan kapag failure to utilize community resources, ibig sabihin ito, hindi siya aware sa sa health center. Kadalasan yung mga cues mo. Okay, kapag failure to utilize community resources for health care, hindi sila aware sa health center, sa mga access sa gamot, hindi sila aware. Letter boy. Bakit? Okay, which among the following family nursing problems will Nurse Patpat identify if the family members have shown inadequate knowledge of community resources for care? Inadequate knowledge. Family members inadequate knowledge of community resources of care. Alam ba nila yung problem na dito? Yes or no? Yes. Diba? Alam sila kasi kaya lang hindi nila ma-utilize. Okay, alam nila. Okay, inadequate knowledge of community resources for care. Okay. Inadequate knowledge. Okay. Yung dito kasi utilize to. So most probably hindi ito. Okay, hindi yan yun. Meron ba about your home conducive environment? Wala. Tamang sagot, letter dog. Letter dog. Ay, letter dog. Bakit? Gagalit na mga person. Okay. Bahay. Which among the following nursing problems will Nurse Patpat identify if she observed the family members using aggressive communication, rather assertive communication when trying to resolve a conflict within the family? Ano kaya yan? So kapag ganyan, sa bahay mismo yung problema, di ba? Bahay yung problema. Okay, meron ba sinabi about the problem? Wala. Utilize community? Wala. Okay, make decision? Wala din. Tamang sagot, letter C. Okay, letter C. Tama na. Tama na yung sagot. Di pa din. At least tama na. Bali-baliktad. Ayun lang. Next, Nurse Lily is planning to conduct qualitative research. Before doing so, she refreshes herself regarding different qualitative research designs. Which among the following is correct? Description of an methodology. Tamang sagot dito. For sure, hindi niya rin maintindihan to. Anong tamang sagot dito? Letter. Sure ako dito. Sure ako dito, hindi niya to. For the jumble ko hanggang 44. For the jumble hanggang 44 ng sagot. Tamang sagot is letter C. Okay, letter C. Letter C. Yung naman, it seeks to understand the rules, mechanism, and structure of correspondence between people. This is your discourse. analysis. Okay, this is your discourse analysis. Okay? Option A mo naman po, describe the human behavior, studies behavior and as it involves in cultural context. This is your human ethology. Okay? Human ethology. Ito, this is your ecologic psychology. So letter cat. Ano daw yung number 42? Ano daw yung an ethology? Ano daw yung ethology dyan? Letter apple. Okay, letter apple. Daanan na lang natin to. Apple. How about this one? Ano daw yung discourse analysis? This is your letter. Discourse analysis. Discourse analysis, letter C. Okay, letter C. Ano naman daw yung ecologic psychology? Ano the ecologic psychology? Letter dog. Na perfect to be. Ang galing naman. Na perfect nyo. Ay. Galing. Ang galing. Okay. Number 45. Mali lang. Okay. This is described as information about the culture that is so deeply embedded in cultural experience that members do not talk. Ano nga yung tamang sagot dito? Feeling ko na-discuss na to sa inyo. Deeply embedded that the members do not talk. This is your, ano kaya? Ay, hindi pa. Okay, kapag ganyan, may sabihin nito, hindi na to napapansin, parang naging norm na siya sa kanila na parang normal na sa amin to kasi ganyan-ganyan. Hindi nila alam na culture na pala nila yun. Okay, culture na pala yun. That is your letter apple. Tacit knowledge. Okay, tacit knowledge. So letter apple. Your B, C, and D, invento lang po yan. Okay, invento lang siya. Okay, invento lang po siya. Hindi ako to. Letter apple. Next. This design focus on a story as the objective inquiry to determine how individuals make sense of events in their lives. Hala, niyayaya na ako mag-bon. Paano yun? Charot. Joke lang. Ayoko maging bon. Alam niyo ba yung qualifications ng bon? Alam niyo yung qualifications ng bon? Alam niyo yung qualifications ng bon? Hindi dapat yung buhok niyo maikling ganon. Pansinin niyo lahat ng bon maikli yung buhok na ganon o kaya kulot-kulot. Pansinin niyo. Pansinin niyo lahat ng bon naka-apple cut na ganon. Yun ang number one. Number one na qualifications. Joke lang. Joke lang. Alam mo ka. Pero totoo hindi. Umamin kayo dyan. Diba? It is not it is deeply embedded in cultural experiences that members do not talk. Diba? Totoo, tacit knowledge yan sa mga bond. Pero ako napansin ko kasi pansinin niyo lahat sila naka-apple cut. Okay? This focuses on story. Story. Kapag story, ano ginagawa mo? Nagna-narrate ka ba? Yes or no? Kapag nagso-story ka, nagna-narrate ka ba? Yes. Yes. Tamang sagot, letter dog, narrative analysis. Diba? Pag pag medyo, ang tawag ito, nasa desperate mode ka na, yun na talaga sasagutin mo, B. Letter dog, narrative. Okay? Next. Categories elicited from the data are continually contrasted with data obtained earlier. in the data collection process so that commonalities and variations can be determined. Okay? Ang continually dyan, kapag continually ba constant, yes or no? Pag continually constant ba siya, yes or no? Yes. Kapag contrasted, pag nagko-contrast ka, nagko-compare ka ba, yes or no? Pag contrasting, yes. Tamang sagot, letter, ano kaya? Letter boy. Constant comparison. Okay? Letter apple, letter C, and letter dog are fictitious. Isabihin ito, invento lang. Letter boy. Okay, letter boy. Nakalagay, ano yung other options are fictitious. Okay. Ang ina yun, yung juxtaposition, yung mga ganyan, yung mga inano nyo, sinagot nyo. Okay, letter boy. Nurse Tanggol is about to conduct descriptive phenomenology research regarding the citizens of Barangay Quiapo. He is studying the steps of indescriptive phenomenology studies. When Nurse Tanggol conducts your steps of intuiting, he will need to So ano ba yung ano mo, steps mo? 'Di ba? Ang steps mo, number 1 diyan magsisimula sa bracketing. Tapos intuiting. And then analyzing. And last is your descriptive. Ang intuiting mo daw po is letter boy. Remain open to the meanings and attributed to the phenomenon by those who have experienced it. Okay? Your letter, ang bracketing po, ito yun siya. Okay, ito siya, bracketing to. Okay, bracketing. Ang letter apple mo, this is your analyzing. And your letter dog is your descriptive. Okay? Hindi ako to promise. Hindi ako yung gumawa nito, promise. Madali lang yung ginawa ko, promise. Ako nagsasabi sa inyo. Madali lang yung ginawa ko exam. Next. Ano daw yung describing dito? Di ko sure kung sino ang NP1. Titingnan ko kung sino ako sabihin ko sino NP1. Di ko sure kung sino NP1 pero nasa wait lang, check ko. Okay. Ang NP1, ano to yung research? Tsaka CHN. Wait. Wala, hindi ko makita. Sir Raymond nga. Sir Raymond. CHN. Describing letter dog. Okay. Letter dog. Letter dog. Letter dog. Letter dog. Okay. Describing. 50. Naulit lang to. Okay. Naulit lang to. Siguro nagkamali lang to. Nagkamali lang siya. Pero he is meant to be describing the bracketing. Kaya letters ito. Dinidescribe niya si bracketing dito. Nagkamali lang. Okay. Bracketing talaga yan. Okay. Letter C. Ito bracketing ang inaano niya talaga dito. Bracketing. Okay. Bonus na lang yan. Number 50. Number 51. Analyzing as descriptive phenomenology involves which of the following actions? O analyzing daw. Ang analyzing mo is what? Letter apple. Okay, letter apple. extracting significant statements, categorizing and making sense of essential meanings of the phenomenon. Letter apple. Letter apple. Letter apple. Next, Nurse Arabella is interested in conducting a mixed method research study, combining both the features and quantitative and qualitative designs. The following questions apply. The advantages of mixed methods design include the following. Excepto. Okay, may except yan. Tamang sagot. Letter. Ano kaya yan? Except yan. Except, may excepto. May except yan. Bonus, opo, bonus po, opo. Okay? Ano kay except dyan? Oh, kala naman, 1050, carry 1050. 1050, break tayo 1050. Except talaga siya, except. Bonus po yan, bonus po, opo. Kung bonus yan, alam mo yung sagot. Anong sagot dyan? Ang lahala kay except dyan. Ano yung sagot dyan? Ano yung except dyan? Letter, letter dog. Okay, letter dog. Alam yung sagot. Ano yung complementarity? Ito yung complementarity. Qualitative and quantitative approaches are complementary. They represent words and numbers, the two fundamental language of human communication. Okay, your incrementality. Qualitative findings can be tested quantitatively, and quantitative findings sometimes needs clarification through in-depth probing. Okay, and lastly, your enhanced validity. Ito siya. Yeah. Enhanced validity when a hypothesis or model is supported by multiple complementary types of data. Researchers can be more confident about their inferences and validity of their results. Letter dog. Letter dog. Okay. Next. The typology of mixed methods, where the qualitative and quantitative aspects are implemented as discrete elements of the overall inquiry and remain distinct during data collection analysis. Tamang sagot. Ano kayang tamang sagot dito? Letter apple. Okay, component design, the qualitative and quantitative aspects are implemented as the discrete components of the overall inquiry and remain distinct during data collection analysis. Kapag integrated design naman, there is a greater integration of the methods and types at all phases of the project, from the development of research questions through data collection, analysis to the interpretation of the ayan siya. Yung composite typology and alternating typology is what? Fictitious. Okay? Ay, charot. Mali pala yung ano ko na kopya. Wait lang. Yan. Invento si letter boy and letter dog. Uy, grabe naman. Charot. Bakit? Ayun ba yung nasasagutan nyo? Yes. Ganyan po ba kahirap ang board exam? Well, ang word kasi na mahirap is relatively, anong tawag dito? Subjective. Okay, relatively subjective yan. Meron mga ibang pre-poll na na mahirap daw. Mahirap siya in a way kasi tricky. Tricky ang board exam. Okay? It requires your high-ordered thinking skills kasi when it comes to the board exam. Hindi siya relatively na parang, kapag nakita ko itong sagot, ito yung sagot. Hindi siya ganun sa board exam. Pag-iisipan mo kasi siya. Pag-iisipan mo siya. Next, the typology of methods where it's a greater incorporation. Ang tamang sagot dito, tamang sagot, letter dog na yan, B. Okay, dog na to. Letter dog. Letter dog. Nurse Arabella gathers qualitative data as the basis for generating the wording on quantitative scales that are subsequently subjective to rigorous testing. This application of mixed method is called, ano kaya tamang sagot? Mag-rigorous testing ka. So, pwede ka bang gumawa ng parang questions? Yes. Letter boy. Instrumentation. Okay, letter boy. Tama na kayo dyan. Yes. Okay. On number 56, Nurse Arabella collects insights from in-depth qualitative studies, then evaluates and confirms these insights with larger samples in quantitative studies. Tamang sagot, sabihin nito, larger samples, okay, larger samples in quantitative studies, sabihin nito letter, ano kaya yan? By definition, it's letter apple. Hypothesis, generation, and testing. Okay, letter apple. Letter apple. Nurse Arabella uses qualitative data to explain the meaning of quantitative descriptions or relationship. Ano kaya yan? By definition, ay alam yung tamang sagot, letter dog. Okay, letter dog. Okay, letter dog. Number 58, use of multiple methods provides great opportunity for potential disconfirmation of theory. If the theory can survive these assaults, it can provide stronger context for organization of clinical and intellectual work. This application of mixed methods research is called, it is your, ano kaya? Letter 56 is letter apple. 57 is letter dog. Tamang sagot is letter apple. Theory of building, testing, and refinement. Okay, theory of building, testing, and refinement. Letter B, C, and D are your, anong letter B and C? D, invento po. Okay, are invento. Okay, B, C, D are invento. Kaya pa. Nurse Arabella is aware that mixed method studies can also be used or applied to intervention development. Which among the following is not correct reason for this research application? Tamang sagot. Intervention research is increasingly likely to be mixed method research. Yes, tama to. Qualitative research can be used to test efficacy and effectiveness of nursing interventions. Yes. Developing intervention must be based on understanding of why people might not adhere to the protocols. Yes. Okay. Pansinin mo, letter B and C are almost opposing answer. Diba? Almost opposing answer dito. Pansinin nyo. So that most probably nasa B or C lang ang tamang sagot. Tamang sagot, letter boy. Kasi qualitative research is beginning to play a role in developing interventions. Okay? Again, qualitative research is beginning to play a role in developing interventions. Letter boy. Next. Nurse Julian was hired by Unilab, a pharmaceutical company, to lead in the ongoing clinical trials of a new drug being formulated for commercial production. The following questions apply. Okay? So ilan daw ba ang phases ng iyong clinical trials? Sure na sa 4? Sure na sa 4? Sure na sa 4? Yes, correct answer is letter boy. Okay. Letter boy. Letter boy. Okay, next. Ano ba yung mga phases mo muna? Discuss lang natin yung mga phases nyo para at least alam natin. Okay, your phase 1, okay, phase 1 trial mo. Kadalasan, ang ina-identify mo dito is the safety tolerance, optimal dose, or strength. Yan siya. Your phase 2 po, kadalasan to, ano siya? Phase 2 is what? Controlled effectiveness. Effectiveness ng gamot. Effectiveness and the pilot testing. May pilot testing. Ang phase 3 mo naman, okay, phase 3 is what? Dito na papasok si full experimental. Dito papasok si RCTs and your treatment efficacy. Okay? Yung phase 4 mo, okay, kadalasan ang phase 4 mo, nag-involve yan ng general population. Okay? And the effectiveness of the study. Kadalasan ang ano dyan, general population. For example, anong phase mo na when it comes to your biogesic? Yung mga paracetamol mo na, anong phase na kayo ng paracetamol mo? Phase 4. Okay. How about your MMR vaccines? MMR vaccines nasa phase 4. Bakit? Lahat po ng gamot na readily available sa market is under phase 4 trial pa din sila. Yes or no? Yes or no? Yes. Okay? Bakit, sir? Kasi hanggang ngayon hindi natin fully aware, hindi tayo fully aware kung anong effect niya in the long term run. Okay, hanggang ngayon, 'di ba? Your drug is still a poison, yes or no? Drug is still a poison? Yes, poison pa din ang drug mo. Okay? So kung controlled effectiveness ang hinahanap mo, anong tamang sagot dito? Letter Letter apple. Phase 2. Okay, phase 2. Number 62. This phase of clinical trial establishes safety tolerance and to determine optimal dose or strength of the therapy. That is your phase 1. Okay, phase 1. 63. This is a phase of clinical trial studies. The effectiveness in general population. This is under your phase 4. Very good, phase 4. This phase of clinical trial is a full experimental test. RCT, kapag RCT mo, it is your phase 3. Phase 3. And number 65, this phase of clinical trial determines the treatment efficacy under what? Ano kaya to? Phase 3. Okay, phase 3. And this one emphasizes external validity. Okay, external validity often that has shown promise of efficacy under controlled but often artificial condition. This is under your phase. Ano kaya to? Phase 4. Okay. Phase 4 na external validity na siya. Okay. Well, let's have 10 minutes or 15-minute bladder break. 10 minutes or 15 minutes? 15. 11:05. Balik na 11:05. Yes. Okay. Balik ng 11:05, bladder break muna. Thank you. Pahingan yung utak niyo, B. Buhay pa. Buhay pa. Oy. Ang init, grabe. Buhay-buhayan. Kaya pa. Ang init, grabe. As in, super init. Kaya papawisan na ako. Nakatapat pa sa akin yung aircon. Ito, ako gumawa nito. Pansinin nyo, madali lang ginawa ko. Number 67. Okay, the Philippines continues to witness infectious disease, ID outbreaks, HIV, TB, malaria, and dengue are serious public health concerns, imposing a significant burden on healthcare services. Nurse Shire is a communicable disease nurse in her village. The following questions apply. Nurse Shira is checking the result of patient X who is suspected to have pulmonary tuberculosis, which of the following interpretation would mean that Mycobacterium tuberculosis is detected. Tamang sagot. Ngayon, tamang sagot dito. So kapag ganyan, saan ba nagsisimula tuberculosis? Anong letter nagsisimula ng tuberculosis? Letter T. Anong tamang sagot? Letter boy. Okay, letter boy. Okay. Ano ba ibig sabihin ng letter N? Ang letter N ibig sabihin not detected. Not detected. Okay. Ano ibig sabihin ng R? Ang RR is ibig sabihin to rifampicin resistant. Okay, resistant. Okay, letter I. Ano kaya letter I? That is invalid result. Invalid result. Correct answer is letter dog. Letter dog. Di ba sabi sa inyo, madali lang akong gumawa ng pre-boards. Next. Nurse Shira is about to give health education to patient X, who is recently diagnosed of pulmonary tuberculosis. Patient X is about to take rifampicin. Which of the following is an expected adverse reaction of rifampicin except, tamang sagot. Ano hinanap mo? Tama or mali? Hinanap mo, tama or maling sagot? Maling sagot kasi meron kang except. Tamang sagot dito. Anong tamang sagot? Ano kayang correct answer? 68 is letter. Letter dog. None of the above. Opo, none of the above. Okay? Your rifampicin kasi, adverse reaction of your rifampicin would include your GI intolerance. Okay? Orange-colored urine, flu-like symptoms, severe skin rash, jaundice, oliguria, albuminuria, thrombocytopenia, anemia. Lagyan natin. Alam ko yan pag mga alam ko yan pag pag hindi niyo talaga alam sagot, it's either all of the above basta sagutin niyo. Shock. Yan. 'Di ba? Pag hindi niyo alam yung sagot, none of the above na yun, Mati. Okay, letter dog. Letter dog. Next. Based on the classification of drug susceptibility testing, tuberculosis is the resistant to at least both isoniazid and rifampicin. It is, tamang sagot dito, both siya. So kapag rifampicin resistant siya sa rifampicin. Okay? Resistant siya sa rifampicin. Ang polydrug resistance mo, okay? Ang polydrug resistance mo, resistance to one or more first-line anti-TB drug. Aside from isoniazid and your rifampicin. Yan siya. Ang extensively drug resistant mo, resistance na yan sa second line of your tuberculosis. Okay? Tamang sagot, letter boy. Letter boy. Letter boy. Tama, sagot. Number 70. Ang 78-year-old patient who was diagnosed with rifampicin-resistant TB went to the health center to get this medication. Nurse Shaira is aware that a patient diagnosed of rifampicin-resistant TB should be given specific medication. So like all that applies. Ano kayang tamang sagot dito? Tamang sagot? Ano kaya? O syempre nandyan si pyrazinamide, kanamycin, cycloserine, levofloxacin, prothionamide. Correct answer is letter cat. Letter cat. Okay, letter cat na yan. Diba? Letter cat. Kasi nilagay ko na dyan, it's either all of the above or none of the above para pampalito. Letter cat. Letter cat. Letter cat. While Nurse Shaira is strolling in the village, Angelita approached her if she can use another form of contraception because she is taking her anti-tuberculosis drug. Angelita is currently on oral contraceptives. Nurse Shaira is aware that which anti-tuberculosis medication that has an interaction with oral contraceptive. Tamang sagot? Ano kaya? Tamang sagot dito is letter. Okay, letter up. Letter dog, rifampicin. Okay, rifampicin. Bakit, sir? Ang rifampicin mo kasi interacts with the medications with the decreased protectivity efficacy against pregnancy. Okay, ano bang gagawin mo kapag ganyan? It's either higher dosage ka ng estrogen, okay, or use another form of your contraceptive. Okay, kapag ganyan, use another form of contraceptive or higher dose of your contraceptive, yung OCs mo, oral contraceptive. Letter dog. Okay, letter dog. Next, a patient who undergoes her hemodialysis 3 times a week. 67. Ay, B, ang layo na natin, B. Sa kapag ang tendency kasi niyan, lesser efficacy kasi siya. Okay, lesser efficacy siya. Nurse Shaira will expect for the dose adjustment of medication of its treatment except, okay, tanong dyan, ang pyrazinamide ba nephrotoxic, yes or no? Or na-excrete ba siya via your kidney, yes or no? Yes. Okay? Yes. So, X to. Ethambutol mo ba? Na-excrete ba siya? Sa kidneys? Yes. Streptomycin ba? Nephrotoxic ba to? Yes or no? Nephrotoxic ba ang streptomycin o isoniazid? Ang nephrotoxic dyan is your streptomycin. Okay, streptomycin ang nephrotoxic mo, letter apple. Yung isoniazid mo kasi na-eliminate siya via your biliary excretion. Okay, na-eliminate siya via your biliary excretion. Letter apple. Letter apple. Letter apple. Okay, letter apple. 73 in accordance to the 6th edition. Okay, of Manual Procedures, Tuberculosis and Latent Tuberculosis Screening. Diagnosis and management, the following are indicated for patient on standard short treatment regimen as baseline, laboratory examination and diagnostics except, tamang sagot? Ano kayang tamang sagot dito? Ang laki na ay ng liwanag. Tamang sagot? Letter. Ito, okay, according to your 6th edition kasi, kasama pa din si mental health screening mo. Okay, kasama si mental health screening mo. Yes, kasama si ECG, kasama si chest x-ray. Ang hindi po kasama si arterial blood gas. Okay, arterial blood gas ang hindi kasama. Ayan siya. Ayan. Okay. So letter C. Letter C. Dami sa akin pag next na. Next. A newly diagnosed HIV 24-year-old female patient with CD4 count of 250 went to TB Dots Health Center because she was diagnosed of PTB 2 days ago. Patient is asking if she can take ART medications and anti-TB medications at the same time. What would be the response by the nurse? Tamang sagot. Ano yung tamang sagot dito? Tamang sagot is letter, ano kaya? Letter dog. All of the above na yan, B. All of the above na. Bakit? Bakit? Okay. Pwede kasing ma-defer. Okay, pwedeng ma-defer yung ARTs mo until completion of your TB. Lalo na kung wari hindi ka naman po life and death situation. Okay? Pero pwede din naman siya i-continue. Okay, pwede din naman siya i-continue. Pwede din naman i-defer yung ART until completion of the intensive phase of TB treatment and then use ethambutol as isoniazid in continuous phase. And the doctor may treat TB rifampicin containing regimen and use of efavirenz plus 2 nucleoside reverse transcriptase inhibitors. Correct answer, letter dog. Okay, letter dog. Next. Nurses as the point of first contact are well positioned to detect, treat, di ba ang dali lang ng ginawa ko, and refer patients with communicable diseases, as well as to provide information, education, and counseling to the public on prevention of communicable disease. The following questions apply. Sophia was bitten by her dog. She is asking Nurse Ron of what are the possible signs that her dog is a carrier of rabies. Which of the following clinical signs of rabies in domestic animals except, tamang sagot? Ano yung tamang sagot? Except, tamang sagot, it's letter, ano kaya? Siyempre, withdrawal and resistance to contact, yes. Sexual as excitement with attempts to mount inanimate objects, yes. Flaccid or deviated tail or penis, yes. Anong tamang sagot? All of the above or letter boy? Tamang sagot, letter boy. Bakit? Kasi po dapat dilated pupils siya. Okay? Dilated pupils po dapat. Okay? Wide-eyed, reduced frequent or absence of blinking with dilated pupils. Oy, grabe naman. Okay. Grabe naman, sexual is, ano yan, never pa ako nakita kasi ng reveal. Okay? Letter boy. Next. Which of the following is true about your post-exposure prophylaxis of rabies vaccine? True daw. True naman. Pag in-hit yung aso, lahat na lang papatulan ng aso. Diba? Pregnancy shall be contraindicated? No. Okay, pwede siya sa pregnant. Okay? Ang rodents ba, guinea pigs and rabbits ba? Ano? May rabies ba sila? Yes or no? None. None. X to. X to. So wala ng all of the above. Anong tamang sagot? Letter boy. Okay, letter boy yan. Okay, letter boy. Okay, letter boy. Letter boy. Next, number 77. Black water fever occurs in some clients with malaria. Which of the following should the nurse assess this client? Ano ba ibig sabihin ng black water fever? Ano kaya ibig sabihin ng black water fever? Ano to? Nagkakaroon siya ng intravascular hemolysis, hemoglobinuria, tamang sagot. Ano kaya? Ano kaya dito? Siyempre, pag black water, inimbento lang po yung black colored teas. X to. X mo din to. Okay. Coffee colored saliva, invento lang din to. B. Tamang sagot, letter apple. Dark red urine. Okay, letter apple. Nurse Derek is counseling for a client with gonorrhea. What additional fact about gonorrhea besides the fact that is highly infectious should the nurse teach this client? Di ba ang gonorrhea mo, pwede ba siya mag-cause ng PID? Yes or no? Pelvic inflammatory disease? Yes. Kapag may pelvic inflammatory disease, saan ka pwede mag-lead? Saan kaya? Letter C. Okay, it can produce sterility. Bakit madali ka ba gumaling sa gonorrhea? No, 'di ba? Common to sa penicillin resistant. Yes or no? Penicillin resistant? Yes. Okay. Rare ba ang gonorrhea mo? Rare ang gonorrhea? No, common ang gonorrhea mo. 'Di ba? Common ang gonorrhea. And it is limited to your internal genitalia. Okay, internal genitalia siya. Internal genitalia. Nurse Derek is caring for a client with diagnosis of acute salpingitis. Which condition is most commonly causing inflammation of fallopian tubes should the nurse include when planning a teaching program for this client? Tamang sagot, B, nasa number 78 mo na yung sagot. Huwag na mag-overthink. Pag nag-overthink pa ang person, letter boy, gonorrhea. Letter boy, gonorrhea. Okay, letter boy, gonorrhea. On number 80, a client understand how syphilis was contracted because there has been no sexual activity for several days. Which length of time associated with incubation of syphilis should the nurse include in teaching plan? Tamang sagot. Ano kayang tamang sagot? Letter. Ano yung favorite answer nyo? Feeling ko may nag-letter D dito kasi ano? Ay, letter E. Kasi bagong option. Di ba? Bagong option to, letter E na lang. Tamang sagot, letter dog. Okay, letter dog, 2 to 6 weeks. Okay, letter dog, 2 to 6 weeks. Okay, letter dog. Kasi ano yan, kadalasan po, pwede siya mag-appear in 9 days. Okay, as long as 3 months of exposure. Okay, letter dog. Okay, letter dog. Next, situation, the biggest contributor to a system-related morbidity and mortality is coronary artery disease. Arteriosclerosis is a progressive disease that affects arteries throughout the body. In the heart, arteriosclerotic changes are clinically known as your CAD. The nurse has completed an assessment on a client with decreased cardiac output. Which finding should receive the highest priority? Tamang sagot dito. Ano kaya? Dito, pag magsasagot kayo naman ito, HOTS question kasi to. Okay, kapag mga HOTS question, di ba sabi ko palagi, identify what is expected at hindi expected. Okay, BP mo na 110/60, expected ba to? Yes or no? Expected ba? Or nasa normal range pa to? Yes. Okay, nasa normal range. How about your atrial? Atrial fibrillation, expected ba to? Expected ba magkaroon ng atrial fibrillation? Pwedeng hindi. Okay, pwedeng hindi yan expected. Okay? Heart rate mo 82, expected or hindi? Expected to. Crackles, expected ba magkaroon ng crackles ang decrease? Cardiac output, yes or no? Expected ba magkaroon ng crackles ang isang may decrease cardiac output? Kapag decrease cardiac output, kamusta ang output mo? Mabagal, di ba? So, pwede ba mangyari? Magkakaroon ng pooling ng blood sa may lungs. Lungs mo. Yes. So, dapat magkakaroon ba siya ng fluid volume overload? Yes. Expected. Expected to. Okay. Oxygen saturation of 92. 2 LPM via nasal can. Tandaan nyo, decreased cardiac output. Kamusta perfusion sa extremities nito? Kamusta? Mababa. Expected or hindi? Expected mo yan. Expect mo medyo ano pa yan. Okay. Respiration of 20? Yes. Okay. Edema. Expected mo ba may edema ang decreased cardiac output? Expected mo ba? Yes. Possible yan kasi ano, kamusta cardiac output mo mababa. So possible ba magkaroon ng pooling of blood sa lower extremities? Diba? Yes. Expected mo yan. Weight gain. Expected. Weight gain in 3 days. Yes, expected yan. Hindi yan umiihi eh. Okay, and 113 mataas nga to. And mild dyspnea expected. Bakit letter boy? Okay, letter boy ang tamang sagot. Bakit letter boy? Confusion. Confusion, alteration of your LOC, di ba? Altered level of consciousness. Plus decreased UO. Pwede ba yan nagsashock yung patient mo? Yes or no? Yes. Okay, pwede sign of shock na yan. Correct answer is letter boy. Okay, letter boy. Or the shock na ang person. Tama kayo dyan. Tama ang mga person. Ay, galing. Okay. Next, the nurse is assessing a different kinds of patient. Which of the following is the greatest source of your coronary artery disease? Tamang sagot. May tamang sagot. Siyempre, di ba, your risk factors sa mga CAD is what? Female, o sino female dyan? Above 60, obese, and high, LDL. Tamang sagot, letter dog. Letter dog. Okay, letter dog. Letter dog. Next, number 83. 83 na ba tayo? 83. The nurse is assessing a client with heart failure. The nurse should assess the following, the client, based on which compensatory mechanism that are activated in the presence of heart failure. Tamang sagot dito. Ano kaya? Ventricular hypertrophy, yes or no? Yes, yan B, lahat may number 1 yan. Ventricular hypertrophy. Yes. Okay. Parasympathetic or sympathetic? Kapag heart failure, kadalasan compensatory mechanism, sabihin ito, mabilis ba yung tibok ng puso mo? Yes. So, sympa pa to. Okay. So, compensatory mechanism, X mo na to. Okay. Renin, angiotensin, aldosterone system, kasama po ba? Yes. Ang tanong dyan, jugular vein distension, kasama ba siya? Yes or no? No, hindi siya kasama. Kasi kapag nag-jugular vein distension ka, ano yan? Decompensatory mechanism na siya. Okay? Decompensated na siya. Tamang sagot, letter boy. Okay, letter boy. Okay, letter boy. Diba? Ang jugular vein distension, nandito yan. Sabihin may pooling na siya. Okay, may pooling siya. Sabihin, hindi na nagpa-function ng maayos yung heart. Okay, so decompensator mechanism na siya. So letter boy. Ayun lang. Letter 135. 135 talaga siya. Okay, 135. Mali sa choices. It's 135. Okay, 135. 835 lang sa... okay. Baka lang nagkamali lang ng ano. Human error lang. Okay. Bonus na lang. Okay, bonus po. Talaga to mga to, nagkamali lang po. 1 out of 100. Malay nyo, di ba? Ano saan tawag sa board exam panay bonus ang exam. Walang ganun B. A client has returned from the cardiac catheterization laboratory after your balloon valvuloplasty of mitral stenosis. Which of the following requirements should the nurse immediate nursing action? Ano tamang sagot dito? Ano kayang tamang sagot? Dito, urine output normal pa to, B, normal output. Okay? SpO2 94% on 2 LPM, normal ba yun? Normal ba siya? Yes, normal pa to. Ano hindi normal? May murmur or somnolent? Ano hindi normal dyan? Somnolent, di ba? Letter cat. Okay, expected mo pa yung stenosis, may murmur pa yan. So letter cat. Letter cat. Somnolent, tulog-tulog. Tulog ka ng tulog. Okay? Tulog ka ng tulog. Kasi bakit? Ang balloon valvuloplasty kasi ang common nito, magkakaroon ka ng emboli. Okay? Common mag-form ka ng emboli. So kapag nagkaroon ka ng emboli, tapos saan siya pwede mag-lead? Pwede ba siya mag-lead to your stroke? Pwede ka ba mag-lead ng stroke kapag may emboli? Yes. One of the manifestation of your stroke is somnolent. Tutulog-tulog ka. Altered level of consciousness. Somnolent kayo ng pre-boards. Di ako nung board exam, sobrang somnolent. As in, sobrang drowsy ko nung board exam. As in, sobrang antok na antok ako nung boards. As in, nilalabanan ko yung antok ko. Hindi ko alam kung bakit. Okay? When teaching a client about self-care, about placement of new permanent pacemaker to his left upper chest, the nurse should include which of the following information? Select all that apply. For sure yan, ang sinagot nyo dyan, all of the above. Sure ako dyan, all of the above ang sagot nyo dyan. No, X yun. Okay, X to. Okay? Take and record the pulse rate. Yes. Okay? Yes to. X mo to. Air travel. Avoid air travel. No. Okay? Tamang sagot is 1 and 5. 1 and 5. Bakit? Hindi kasi contraindicated to. Hindi po contraindicated ang paggamit ng microwave oven. Okay? At the same time, hindi mo rin i-mobilize to. Okay? Avoid lifting heavier than 3 pounds. The kids. Okay? Letter boy. Letter boy. Next. A client with bundle branch block is on cardiac monitor. Which ECG should the nurse identify on a client's cardiac monitor? Ano kaya? 3. 3 siya. Ano kayang tamang sagot dyan? Bundle branch block. So most probably ano to? Ventricular ba to? Yes or no? Ventricle siya. Pwede ba tong ventricle? Yes. Letter dog. Widening of QRS to a minimum of 0.12 seconds. Okay. Letter dog. Letter dog. Hala na. Madali lang yung part na exam ko. Madali lang yung part. Madali umamin kayo, mas madali as compared sa, ano pa din. Kala ko madali. Okay. What changes in pressure does the nurse conclude is reversible for the lower extremity pitting edema of a client with right ventricular failure? Tamang sagot. Letter. Ano kaya? Letter. Apple. Okay. Increase in plasma hydrostatic pressure in right ventricular heart failure. Blood backs up in the systemic capillary beds. The increase in plasma hydrostatic pressure shift fluid from the intravascular compartment to the interstitial spaces, causing your edema. Letter apple. Letter apple. Number 88. Which signs of a nurse suspect a cardiac tamponade after a patient has cardiac surgery? Tachycardia, yes or no? Tachycardia, yes. Hypertension expected. Hypertension expected. Cardiac tamponade. No. Hindi po. Okay, no. Tanggalin mo si 1, 2, 3, 4. Tanggalin mo to. Okay? Decreased UO. Expected or hindi? Yes. Expected to. Jugular vein distension expected. Ang tanong dyan, decrease CVP, increase CVP. Increase or decrease CVP? It should be, o di ba, central venous pressure. O nakakapag-pump pa ba kapag cardiac tamponade? Nakakapag-pump pa ba kapag cardiac tamponade? No. Kamusta venous pressure mo? Pulling of blood, tataas bababa. Central venous pressure, vein mo, aakyat yan. Okay, increase ang CVP mo. Correct answer is letter cat. 1, 4, 5. Okay, 1, 4, 5. Next, the pulmonary system consists of the thorax, conducting airways, respiratory airways, and pulmonary blood and lymph supply. The primary function of the pulmonary are the ventilation and your respiration. The most important nursing action when measuring a client's pulmonary capillary wedge pressure is, ano kaya to? Ano mo na ba ang pulmonary capillary wedge pressure? Ito, mini-measure mo dito ang ano, your left ventricular failure and your mitral stenosis. Okay? Left ventricular failure and your ano, mitral stenosis. Tamang sagot, letter, ano kaya? Letter A. Deflate the balloon as soon as the PCWP is measured. Letter apple. Kasi bakit? May interfere niya kasi yung blood flow sa lungs. So letter apple. Apple. A nurse uses abdominal thoracic thrust or your Heimlich maneuver when an older adult in a senior center chokes up on a piece of meat. Which volume of air is the basis for the efficacy of the abdominal thrust to expel a foreign object in the larynx? Tamang sagot. Ano kaya yan? Letter it is your letter boy, residual. Okay, residual. The residual volume is the amount of air remaining in the lungs after a maximum exhalation. Letter boy. Letter boy. Letter boy. Okay? Eh yung D, yung D mo kasi expiratory reserve, ito siya. After your normal, yung kaya mo pa ilabas pa. And then your residual volume after expiratory reserve, yung kaya mo pa malabas after the expiratory reserve. Okay, ayan siya, yung illustration niya. Diba? Tidal volume yung normal RR mo. Normal RR mo yung tidal volume. Yung kaya mo pa ilabas after your normal RR, that is your expiratory reserve volume. Kapag meron ka pang kayang ilabas after the expiratory, that is your residual volume. Mas ano kasi ako, mas illustration kasi ako. Mas naiintindihan ko pag ganyan. Okay? Next. A nurse identifies the clients with hemoglobin is decreasing. Is concerned about tissue hypoxia. An increase in what diagnostic test result indicates an acceleration in oxygen dissociation from hemoglobin. Kapag kapag hypoxia, kamusta yung O2 mo? Tumataas, bumababa? Decrease. So X mo to. Okay, kapag nag-decrease ang O2 mo, ano tumataas? Yung pH or CO2? CO2. Okay, CO2, correct answer is letter cat. Letter cat. Okay, letter cat. Your pH value would, pH value mo would increase, decrease. decrease din. Okay? Tapos magiging compensatory at the end, si HCO3 tataas din siya. Magiging compensatory siya, but not a reliable. Mas reliable mo si PCO2. Letter cat. A client is admitted with atelectasis. Which clinical manifestation does the nurse expect to identify when assessing a client? Tamang sagot. No, kapag atelectasis yan, sinabi ko, pag atelectasis, normal temperature po ba? Yes or no? Normal temp? No, hindi po siya normal temp. Ano siya dapat? Ano siya dapat? Kapag atelectasis, hypothermic, hyperthermic. Ano kaya? Hyperthermic. Nilalagnat sila. Okay, nilalagnat sila pag atelectasis. Okay, nilalagnat sila. Okay? Slow ba or rapid? Slow, rapid? Yes. It is rapid, shallow. Rapid, shallow to. Okay? Rapid, shallow. Expected mo ba dry, unproductive cough? Yes or no? No. Okay, expected mo loose na loose and productive cough. Okay? Loose and productive cough. Correct answer is letter dog. Letter dog. Letter dog. Next. Pleural effusion may exacerbate dyspnea in patients with COPD. Physical examination may demonstrate decreased or absent breath sounds with dullness to percussion related to pleural effusion. Transudative and exudative pleural effusion are distinguished by measuring the lactate dehydrogenase levels in the pleural fluid. Which of the following must be met in order to consider as pleural effusion? Tamang sagot. Tamang sagot kaya. Letter boy. Okay, letter boy. Dapat more than 0.05 siya. Letter boy. Okay, letter boy. Danan lang natin to. B, ang hirap nito masyado. Transudative pleural effusion can be attributed to the following disorder disease except tamang sagot. Ano kaya? Letter dog. Okay, letter dog. Pulmonary embolization. Okay? Your transudative pleural effusion, ito yung mga transudative pleural effusion mo. Ito. Yan. Congestive heart failure, cirrhosis, nephrotic syndrome, peritoneal dialysis, superior vena cava obstruction, myxedema, and your urinothorax. Letter dog. Letter dog. Number 95. A client with pneumonia is experiencing pleuritic pain. The nurse should assess the client for, ano ba yung sabihin ng pleuritic pain? 93 is letter boy. Ang sabihin ng pleuritic pain, ibig sabihin ito, nagkakaroon ka ng friction between your pleural layers. Okay, anong tamang sagot kaya dito? Letter C. Moderate pain that worsens on inspiration. Di ba kapag nag-inspire ka, ano nangyari? Nag-rubbing yung pleural layers mo. Letter C. Number. Situation. Hemostasis, the ability of the blood of the body to control bleeding and clotting, is an intricate balancing act between the coagulation mechanism and fibrinolysis. Disruption of the normal hemostatic balance can result in devastating hemorrhagic and thrombotic conditions. The following questions apply. The client receives heparin while receiving hemodialysis. Nurse Eric explained the rationale supporting anticoagulation by making which of the following statements? Tamang sagot. So ang heparin yung pinag-uusapan dito. So most probably hindi kasama si warfarin dito, X mo to. Okay? Heparin does not enter the body, so there's no risk of bleeding. Yes, your heparin, hindi siya pumapasok sa loob ng katawan natin, but that doesn't mean na risk, wala na siyang risk for bleeding, X to. Clotting time is seriously prolonged. Again, hindi siya pumapasok sa body. Pwede siya alter but not seriously prolonged. Correct answer is letter apple. Letter apple. Letter apple. Ay pinakamahaba. So yun na yung sagot. Oo nga no. Dapat pala inikilang ko yung sagot dito. Charot. Next. Heparin drip is not compatible to the following medication except. Tamang sagot. Hula-hula. Ano yung kapares ng letter? Letter dog. Dopamine. Letter dog. Magkapares ng letter D and D. So dopamine ang sagot. Ay yung magkapares ng amyodorm. Pero letter D. Dopamine. Dati nung last season, 1 to 10 panay ganyan. Ano yung hindi compatible sa ganyang gamot? Ano yung hindi compatible sa ganyang gamot? Anong gamot yung compatible sa ganyan? Dinalian ko na ngayon kahit papaano. Okay? 98. Nurse Eric will use different vacutainer in extracting blood to patient X. What should be the order of the vacutainer upon collecting the blood? Tamang sagot. Hoy, ginagawa namin yan. Phlebotomist ang person. Phlebotomist po ang person. Phlebotomist po ang person. So dapat marunong din kayo magganyan. Okay, ang tamang sagot dyan, mauuna mo yung walang additive. Ano ba yung walang additive kaya dyan? Ano kaya walang additive dyan? Letter, that is your yellow. Okay, yellow ang walang additive dyan. Letter apple. Okay, letter apple. Yung blue mo, para saan ang kulay blue na vacutainer? Para saan ang blue na vacutainer? For your coagulation studies. Okay, for your coagulation studies. Yung red mo naman, usually yan kapag nagpapasave blood sila. Okay, kapag nagpapasave blood sila. Ang yellow mo kasi kadasan, sineseparate si serum and si blood. Si lavender mo, that is usually for your complete blood count. Okay, complete blood count. May additive kasi yan. EDTA. Okay, EDTA. Okay, next. Nurse Eric is giving cephalosporin to his client. He must monitor the client for which of the following symptom. Ano yung pinakamalala kaya dyan? Ano kayong pinakamalalang sagot dyan? Tamang sagot. Ano yung pinakamalalang sagot dito? Letter, tingnan mo, purpura ecchymosis, almost same answer. Infectious emboli, invento lang. Okay? Correct answer is letter apple. Ulit, okay, dito kasi your yellow. Okay, unahin mo palagi ang yellow kasi po, ang yellow mo kasi walang additive. This is for your serum electrolytes. Okay natin. B, hindi lalabas to B. Electrolyte. Baka lumabas. Baka malakas na trip ni Bon. Serum electrolytes. Coagulation. Pero sabi ng Bon, kasi last, kailan ba ako nag-meeting? Kailan 19? Di ba 18 ngayon? Last Wednesday, nag-lecture si Divina Gracia. Sabi ni Divina Gracia, expect nyo daw, okay? Expect nyo daw na lalabas daw sa board exam ay, natong green mo, wait lang, lithium. Yan. Expected na lalabas sa board exam? Ang expected na lalabas sa board exam ay Universal Healthcare Law. UHC. Expect nyo lalabas sa board exam UHC. Sabi niya. UHC. Yun yung sabi niya. Okay? Tamang sagot dito is letter apple. Yun yung sabi niya ha. Yun yung sabi niya. Expect daw, naka-include na daw sa succeeding board exam ang Universal Healthcare Law. Pati primary healthcare. Yun lang sinabi ko na sa inyo. Next, Nurse Eric is assessing a legs of a client with history of chronic venous insufficiency. What physiologic changes should the nurse conclude are the results of this process? Select all that applies. Halamang gamot hindi ko magaling mag-predict ng mga ganyan. Pero expect niya meron yung vaccine, merong CD yan. Huwag niya kayo mag-expect ng rabies, ng leprosy kasi lumabas na siya. Okay? 99 is letter apple. Okay? Chronic venous insufficiency. Okay? Necrotic tissue, expected po ito saan? Kapag peripheral. Okay? Kapag peripheral po. Okay? Ito naman, echemotic mo, di ba? Common to kapag merong bleeding yung patient mo, naka-blood thinners yan. O, chronic venous insufficiency, kapag vein ba, may pulse po ba? Yes or no? May pulse po ba kapag venous? Yes or no? Wala. X mo to. Tamang sagot, letter apple. Letter apple. Okay, letter apple. Questions on your NP1. Tapusin na natin hanggang 12 kung hanggang saan natin makaya matapos. Para lang hindi tayo hagol mamaya. Question on your NP2, ay NP1. NP1. Questions. 100 is letter apple. Apple. Let's go for your NP2. Ito ba yung pinakamahirap? On situation, Mirasol, 28 years old, is 11 weeks pregnant. She is told the importance of genetic testing in the earlier parts of pregnancy to be aware of certain chromosomal conditions that the fetus may have. The nurse prepares Mirasol for the first trimester screening by informing about the procedure. With the blood sample from Mirasol, the nurse needs to further explain when she states that this chemical should be expected in the testing in the diagnosis of your chromosomal abnormalities. Tamang sagot. Ano kayong tamang sagot dito? So dito kasi, ang iyong tine-check po ay what? Ang tine-check mo dito is your chromosomal abnormality, specifically your trisomy 13 and trisomy 18, di ba? Ang AFP mo, alpha-fetoprotein, expected tong mababa sa may trisomy 21 or Down syndrome. Di ba? Pregnancy-associated plasma protein, hindi rin po ito. And your free-beat HCG, correct answer is letter cat. Okay, letter cat. 100 po is letter apple. Apple. Okay, letter C. Okay, letter C. Number 2. Mirasol asks you about the nuchal translucency test. Okay, ano saan ba yung nuchal mo dito? Dito siya. Okay, you tell her that this examination for any. Hinahanap mo dyan, except ang hinahanap mo dyan na related to your trisomy 21 or trisomy 18. Okay, nuchal translucency, you tell her that this examination for any risk of genetic abnormalities will include a sonogram to ensure that, ano kaya yan? 1 po is letter cat. Cat. Okay, dito, okay, ang hinahanap mo dito, di ba? Nuchal translucency test is letter boy. Okay, letter boy, the fetus fluid on the back of their neck is contained and the fold is only 2 mm. Ano ba yung nuchal translucency test? Okay? Ang nuchal translucency test, ito siya. So ang normal mo is ganito. Nandito. Pero kapag may Down syndrome yung bata, ganyan ang kanilang nuchal translucency test. Okay? Ito siya. Yan. Correct answer sa number 2 is letter boy. Next. Nurse Mirasol. Pabalik ko sa question. Sige. Sino po gumawa ng NP2? Secret. Charot. Bakit? Mahirap ba NP2? Hindi ako. Second half ako ng NP2. First half, hindi ako. Hindi ako first half. Second half ako. Alam ko, hindi kayo magre-reply. Si Ma'am Farah, alam ko. Si Ma'am Farah. Okay. Ito, ano daw dito? Mirasol expresses her concern about the possible genetic abnormalities may be tested during the non-invasive testing. Using constant worry, Mirasol continually asks you, the nurse, regarding the different abnormalities that may present in her fetus. She says, I read about newborns having XXY. Kapag XXY, di ba? Kapag may presence ng Y, matik lalaki, babae yun. Lalaki, babae kapag ganyan. Matik, lalaki siya, letter cat. Letter cat. Tama kayo dito. Yes. Okay. This may tama na. Dito daw, genomes can be abbreviated to its normality or aberrations. In the following abbreviations, which of these are found in a newborn with Cri-du-Chat syndrome? Ang tamang sagot dito, B. Yung 21, ano kaya yung 21 mo? Ano kaya yung 21? Trisomy yan, B. Trisomy 21 yan. Okay? So, anong pagpipilian mo na lang? It's either positive or negative. Tamang sagot, number 3 is letter cat. Tamang sagot is letter apple. Okay, letter apple. Okay, letter apple. Dito daw. Ano daw dito? Ang trisomy 21. Down syndrome like letter, magdasal na tayo, letter C. Okay, letter C. Okay, letter C. Next, pregnancy is a normal process involving maternal and fetal adaptations that occur in an orderly sequence. Problems may develop in this physiological process along with the complication that will not only risk the pregnant women but the fetus as well. Nurse Christine is caring for a patient diagnosed with HIV. She is currently 20 weeks pregnant and receiving highly active antiretroviral therapy. According to Nurse Christine, which of these potential risk factors should not be associated with the current diagnosis? Tamang sagot. So ang ARTs po ba, safe ba siya sa mga pedia or sa mga fetus, yes or no? Safe ba siya? Number 5 po is letter K. Safe ba siya? Yes. So magkakaroon ba ito ng birth defect? No. So hanapin mo yung number 5. Tanggal to. Tanggal to. Kapag nag-HRT ka naman, pwede ka ba magkaroon ng pre-eclampsia? No. Okay, no. Yes. Pero kasi, ito siya, when it comes to your genetic, para masabi mo na male ang isang lalaki, ang isang person, as long as na may letter Y siya, kahit kasi abnormality ng XXY eh. Kahit sabihin mo may abnormality siya, as long as yung phenotype, yung genotype niya is may letter Y, okay, as long as may letter Y, okay, lalaki siya. Okay, lalaki siya matik. Okay, kahit sabihin mo sumobra siya XXY, meron siya, lalaki siya automatic. Okay? Ito naman, ang common kasi, dito, hindi naman siya magde-develop ng preeclampsia. Okay, correct answer is letter apple. Letter apple. Ay, shit, sorry. Before the ubo po ang person, meron ka bang COVID? Okay? Mm. So ang common, 'di ba? Ang woman receiving your HR, your heart, ito yung mga common nila. Ito. Okay? So 12 o'clock na, mag-lunch break na tayo, B. Okay, mag-lunch break na tayo kasi kailangan niyo mag-ipon ng energy for your NP. Okay? Lunch break na. Okay? Lunch break na, mag-lunch break muna kayo. Bye-bye. Thank you. Sana masarap ulam niyo. Thank you. Hello. Good afternoon. Kamusta? Uy, gising pa kayo? Kaya pa? Tas NP2 pa 'no, tas ganitong oras, 'di ba? Init, busog. Same, same. Hmm, okey na, let's go na para ano, alam kong hindi naman kayo sasagot dito sa NP2 lalo na yung first half kasi ang hirap talaga niya sagutan. Alam ko 'yan, okey. Number 7. Okay, a patient tells Nurse Christine that she has been feeling incredibly nauseous for the past 8 weeks of her pregnancy. She tells Nurse Christine that she simply is not inclined to take any suggested medication and asks if she can take any herbal medication instead. Which of these herbs, if mentioned by Nurse Christine, entails proper understanding and is safe for the patient? Ano kayang tamang sagot dito? Ano kayang tamang sagot? Hula, anong tamang sagot? Magugulat kayo. Tamang sagot is letter, ano, letter dog. Jiang. Ano ba yung Jiang? Jiang, Jiang, ginger. Okay, Chinese for ginger. Letter dog. Okay, letter dog. Ang silimarin mo kasi is for what? Liver, fatty liver. Okay, fatty liver po kasi ang letter apple mo. And we're looking for the nausea. Okay, letter dog. True. Next, 36-year-old client has entered the post-term and present to the delivery room. She brought along the ultrasound when she was 6 weeks for her vaginal bleeding, another one from she was 20 weeks. According to the patient, she thinks she is 3 days before her due date. However, shows that she has irregular period. Estimated delivery is off by 11 days on the second ultrasound. Her fundal height is 43 cm. Based on this, Nurse Christine determines which of the following methods would be the most accurate. Ano ba mas accurate mo? Physical screening or diagnostic? Huh? Ano kaya pinaka-accurate mo? Physical screening or diagnostic? It is, ano kaya siya, B? Hala. Processing ang utak ko, sir. Ano kaya? Letter C. Okay? Crown rump length on the 6-week sonogram. Okay, sonogram. Okay, letter C. Letter C. Okay, letter C. The nurse received a pregnant patient with COVID-19. Upon research, it has been shown that stillbirth is a complication under what has been termed as your SARS-CoV-2 placentitis. Among these, which of the following does not belong to the concurrent destructive findings that contribute to the condition? So letter, hula tayo dito. Tamang sagot, letter boy. Diffusion of the placental parenchyma. Okay, multiple global studies have found that the placenta pathology present in cases stillbirth consists of combination of concurrent destructive findings that include your increased fibrin deposition that typically reaches the level of massive perivillous fibrin deposition, chronic histolytic intervillosities, and trophoblastic necrosis. Okay, so letter boy. Letter boy. Sorry. Number 10. A 40-year-old woman tells the nurse she had a partial HMO pregnancy 3 months ago. She insists that she wants to get pregnant again and asks her if she and her husband can try conceiving again, which response entails the nurse require further follow-up kapag further follow-up mali from her nurse manager upon knowledge of consultation. Tamang sagot. Letter. Letter dog. Okay, you may not be able to conceive again. Okay? Again, because of the risk of your choriocarcinoma. Bakit? 'Di ba? Ang chine-check mo lang kasi dito, what? Yung BCG levels mo. Okay? BCG levels mo. Okay? Correct answer is letter dog. Diba? Pwede pa din naman siya you may not be able to conceive again. Pwede pa din naman siya mag-conceive. Okay? Next. Nurse Moro prepares to meet newly admitted patients in the obstetrics gynecology ward of Teyvat Medical Center. In there, he cares for pregnant mothers with different conditions. A primigravida client with insulin-dependent diabetes mellitus, Nurse Moro that the contractions stress test performed earlier in the day was suspicious. Nurse Mori interprets this result as indicating that the fetal heart rate pattern showed which of the following. Okay? Kapag negative yan, okay? Di ba pag negative yan, walang late deceleration. Okay? No late deceleration. Okay, ito siya. Wala na yung mga person. Okay, ito siya. Ang frequent deceleration is what? Positive. Okay? Positive. Contraction. Stress. Correct answer is letter cat. Inconsistent, late deceleration. Okay. Suspicious yan kasi inconsistent. Ibig sabihin hindi siya it's either may biglang late deceleration, biglang wala, biglang meron. Letter cat. Meron sa recalls nyo yan? Meron sa recalls nyo? Oh. Next, Nurse Cairo is reviewing a chart of multi-gravid client at 39 weeks gestation with suspected HELLP syndrome. The nurse notify the healthcare provider about which of the following tests. Ano kaya yan? Di ba kapag HELLP syndrome, ang tendency niyan, hypertensive, okay, elevated liver enzymes, and low platelets. Okay, kadalasan kapag HELLP, hypertensive yan. And hemolysis. H din yung hemolysis. Baba, elevated liver, and your low platelet count. Yan. So, ang tendency niyan, okay, the nurse should notify the healthcare provider about which of the following tests. So, platelet count mo, nasa normal pa yan. So, hindi mo kailangan i-notify si healthcare provider. Uric acid mo is still normal. Okay, AST mo is still on the normal range. Diba? Liver enzyme to. Correct answer is letter boy. It indicates what? Ano in-indicate na? Indicates tissue destruction. Okay, indicates your tissue destruction. Yeah. Kaya pa? Kaya pa, B? Kaya pa. Okay. Next, number 13. After instructing a primigravida client 38 weeks gestation about how preeclampsia can affect the growing fetus, the nurse realizes that the client needs additional instruction when she says that preeclampsia can lead which of the following? Diba? Preeclampsia, so ibig sabihin ito, pwede ba ito mag-abruptio placenta? Yes. Okay, abruptio placenta to. Okay. Intrauterine growth retardation, yes, kasi wala ka hindi maganda perfusion mo. Poor placental perfusion, yes. Correct answer is letter apple. Hydrocephalic infant. Tama. Tama ka na dito. Tama. Okay. Next, when developing a teaching plan for a primigravida client with insulin-dependent diabetes about monitoring glucose control and insulin dosages, which of the following would the nurse expect to include as a desired target range of blood glucose? 40 to 60, carry mo ba 40 to 60? 40 to 60 is a range of your hypogly na ba to, B? Hypogly pa? Yes. Okay. 140 to 160 masyado mataas to. Okay. 110 to 140, di ba? Mataas din to. Okay, ang gusto mong range is 40 to 60. Okay, 40 to 60. Ano bang gusto mong range kapag 1 hour post-meal? 100 to 120. 100 to 120. 14, letter boy. Okay, letter boy. On number 15. Nurse No is working with the 4 clients on the obstetrical units. Which client will be the highest priority for C-section? Cesarean. Ano kaya dito? Tamang sagot. Hala, sinundo na ng langit. Ano kaya siya? Letter. Ano kaya? Letter dog. Okay, tama. Very good. Letter dog. Bakit, sir? Herpes lesion. Kapag natamaan si baby or na-touch si baby ng herpes lesion, pwede ba siya mahawa? Yes or no? Yes. Pwede kasi mahawa si baby. So, letter dog. Okay. ROP, yes. Pwede to. Bridge position, we can. Okay. 8 pounds, pwede din yan. Okay, masakit lang siya. Tsaka pwede mag-episiotomy si mami. Pero pinaka-contraindicated talaga for your SVD is your herpes lesion. Okay, letter dog. Lilia is diagnosed of DM at 36 weeks gestation. Lilia has a negative, Lilia's weekly reactive stresses for the last 3 weeks. This week, non-stress test was non-reactive. Okay, kapag non-reactive sa non-stress test, normal, abnormal? Abnormal. So, anong gagawin kaya? Contraction, stress test. Letter apple, very good. Okay, very good. 'Di ba? Kailangan muna non-stress test. Kapag reactive 'yan, 'di ba? Kapag reactive 'yan, that is normal. Kapag non-reactive 'yan, that is abnormal. Okay, nagde-decrease ang kanyang heart rate. So magko-contraction, stress test siya. Letter apple. Okay, letter apple. Tama dito? Tama. Yes. Okay, Nurse Marivic has conducted a class for pregnant clients diagnosed of your DM about signs and symptoms of potential complication. The nurse determines that the teaching was effective if the client makes which statement? Okay, ang tamang sagot. I should not have ultrasounds done because of my diabetic. No, kailangan mo ng ultrasound. Kailangan mo ng ultrasound B. I am glad that I do not have to worry about developing hypoglycemia. Prone ba sila mag-hypoglyc kapag hyperglycemic, yes or no? Yes. Okay, my insulin needs should decrease during the last 2 months because I'll be using some of my baby's insulin. Yes, pwede. Correct answer is letter C. Bakit letter C? Kasi kailangan mo i-watch yung weight mo kasi pwede ka ba mag-cause ng gestational hypertension kapag masyadong mataas yung weight mo? Yes. Okay? Yes po. Okay? Correct answer is letter cat. Letter cat. Number 18. A pregnant client has abnormal 1-hour glucose screen which completes 3-hour, 100 gram oral glucose tolerance test. Which test result should nurse interpret as being abnormal? Ang FBS mo, anong range dapat na FBS mo? Okay? Less than 95. Okay? Less than 95. Okay? Yan, yun. Ang iyong first hour dapat less than 180. Ang second hour mo ay dapat less than 155. 155. Ang third hour mo dapat less than 140. Tamang sagot, letter boy. Letter boy. May tama na kayong sagot? Yes. Mataas na yung score. Mataas na yung score. Hindi pa. Meron pang mas mahirap dito, 'di ba? Yung may graph. 'Di ba? Yung may graph yung mas mahirap. 'Di ba? No, hindi niyo rin maintindihan 'yon. Mamin kayo, naintindihan niyo ba yung graph? Yes. Hindi ko alam. True. Which of the following statement about fetal biophysical profile will be incorporated into the teaching plan for a primigravida client with insulin-dependent diabetes. Okay. Ano ba yung nakaka-determine ng fetal lung maturity? Makalalaman ba yung sa fetal biophysical profile? Yes or no? No. Okay. Paano malalaman yan? Your lecithin? Ay, shit. Sorry. Yung LS ratio. Di ko lang sure kung yes, very good. LS. Malalaman mo ba yung UpGuard sa fetal biophysical profile? No, 'di ba? UpGuard mo pagkapanganak. 'Di ba? Tapos dapat full bladder siya diyan. Full bladder, correct answer is letter boy. Letter boy. Okay, letter boy. With plans to breastfeed her neonate, a pregnant client with insulin-dependent diabetes asked the nurse about insulin needs during the postpartum. Which of the following statements about postpartum insulin requirements for breastfeeding mothers should Nurse Marvick include in the explanation? Ang tendency nito, di ba? Kapag nabubuntis si mami, okay? Si placenta mo yung nagkakos ng insulin resistance mo. Okay, si placenta ang nagkakos ng insulin resistance mo, kaya ka tumataas yung insulin requirements mo. Nawala na si placenta. Sa tingin niyo ba tataas pa yung insulin dosage mo, yes or no? No. Expected mo, letter apple. They fall significantly in the immediate postpartum period kasi wala na si placenta. Si placenta yung nagkakos ng insulin resistance mo. Okay? Okay, yung pagtaas ng requirements when it comes to your insulin requirements. So, letter apple. Letter apple. Carol is being monitored at home at 30 weeks gestation. 19, letter boy. After being diagnosed with mild preeclampsia, according to her health history, she has gained 3 pounds in the past week. Her blood pressure has increased to 144/92 millimeter mercury. Has been having the occasional headache. The nurse has been assigned to administer your Magsul intravenously. Which of the following outcomes are included in the desired results for this kind of treatment in patients with severe preeclampsia? So pag ganyan, alamin mo muna yung mga paano malalaman nagma-magnesium toxicity si patient? Anong palatandaan kapag magnesium toxicity? That is your, ano kaya yun? Magnesium toxicity. Anong palatandaan? That is your burp, di ba? Burp. Okay? Dapat pag mababa yung BP, mababa UO, mababa RR, mababa patellar reflexes mo. So, ayaw mo bang result ang iyong less than 30 ml? Yes. Okay, ayaw mo nito. 'Di ba? Ayaw mo nito. X mo ito. So, tanggalin mo to. Tanggalin mo to. Okay. So, matitira dyan si ano? Anong tamang sagot dito? Letter. Pinaka-best answer is letter dog. Okay. Temperature of 98. Pulse rate of 72. Respiration of 14. Fetal heart. Charot, hindi to. Fetal heart rate of 120. Heart rate of fetal heart rate yan. And then BP greater than 140. At least bumaba na siya kahit paano. Deep tendon reflexes of positive 2. Correct answer is letter dog. Okay, letter dog. Number 22. A client at 29 weeks gestation has been placed in premature labor and is prescribed with Rytodrin, Utopar. In order to maintain the pregnancy, the physician has ordered the client to have 10 milligram now, another 10 milligram in the next 2 hours, and then another 20 milligram every 4 hours while the contraction persistently persists. Making sure not to exceed 120 milligram per day. At what time should the client have the reached maximum dose if she started taking at 10 a.m.? Letter. Okay yan. Letter dog. Bakit? 'Di ba 10 milligrams at 10, tsaka 12 noon. Then ang 20 milligrams mo is at 4 p.m. So total ka na ng 40. Then at 8, then at 10, then at 12, then at 4, then at 8. Kapag saktong 8 a.m., nasa 120 milligrams ka na. Letter dog. Letter dog. Number 23, a client at 26 weeks gestation experienced a premature rupture of membranes as positive of your group B. Streptococcus. Bacteria ba to? Yes or no? Bacteria ba yan? Yes. Okay. She's experiencing contractions of 4 to 6 minutes as vital signs that are as follows. 120/80, temperature of 100, while respirations are 18. As a nurse, you expect the physician to order which of the following medications? Tamang sagot. Ano kaya? Letter. Ano kaya antibiotic dito? Siyempre, bigay ka ng antibiotic. May group B streptococcus. May infection si patient. Letter boy. IV penicillin. Letter boy. IV penicillin. 24. A client has had her epidural removed and develops a severe headache when she tries to sit up in bed. The physician instructed the client that she will need a blood patch. Okay. When the physician leaves, the nurse was then asked by the client what the blood patch is. Which of the following answers would deem the nurse as knowledgeable on the matter? Ano kaya ang tamang sagot dyan? Alam niyo yan. Okay, ang blood patch. Okay, ang blood patch, syempre kung tumingin ka na saan ba may dugo dyan. At saan dyan yung may dugo? Letter cat. Okay, letter cat. Ang gagawin kasi dyan, removal or extraction of the blood from a vein and then injecting it to the epidural space in the back to prevent what? Your CSF leakage. Okay, para ma-prevent ang leakage mo to prevent your headache. Letter cat. May tumama dyan? May tumama? La. Ah, yes. Ang talino, B. Alam nyo yan. Alam nyo yan. Or for the hula lang ang person. Hula. Okay. Carol. True, patch daw, tapalan, di ba? Malalang context clues. Diyan kayo matututo kung paano yung context clues na malala. As in, yung pinaka-desperadong context clues na. Carol has been categorized as a high-risk pregnant and had complicated delivery. She is placed in the recovery room with active bleeding. Active bleeding. Heta starch in sodium chloride IV infusion, okay, has been ordered for her treatment. The nurse is aware that it is indicated for Heta starch. Ang starch mo, ano? Anong ginagawa ng starch mo? Diba? Improving circulation, dilation, hindi. Diba? Increasing heart contraction, di wala naman nakaalagay. It's either C and D yan. Okay, ano ba yung starch? Okay, your starch is what? Plasma expander. Okay, plasma expander siya. Correct answer is letter cat. Okay, letter cat. Diba? Letter cat. Learning, true. Pero lalabas ba sa board exam yun? Parang di naman. Ang hirap naman. Ang hirap naman nung ganyan tanong. Ayan na, yung favorite nyo. Regardless when of a form of dysfunctional labor occurs, the effect on pregnancy will be yield the same. Emotions, anxiety, fear, and discouragement. Di ba hindi naman siya related dun sa mga in order to ease their words and good explanation and being knowledgeable are one of the few skills a nurse must possess. Referring to the graph above, show the types of abnormal labor. Choose the... Hindi ako to, promise, hindi ako to. Ayoko mahirapan kayo. Charot, joke lang. Hindi ako to, promise, hindi ako to, promise, hindi ako to. Promise, hindi ako yung gumawa nito. Ayan daw yung graph. Promise, hindi ako yan. Ay, B, may expected din naman, for example, nung board exam ko, ang lumabas sa amin table. table sa board exam ang lumabas. Yes, table yun. Di ko matandaan kung ano, basta table yun lumabas. Wala pa ako naririnig na nag-graph. Okay? Wala pa ako naririnig na graph. Ay, black and white sa paper? Ayun lang. O sige, screen cap nyo muna. Ayun lang. Yun lang ang mahirap dyan, B. Okay. Ayun lang. Pero expect nyo, wala naman ganyan. Ayun lang. O, screen cap nyo na lang muna. Pero pag hindi black and white, maintindihan niya ba siya? Yan ang tanong. O, kahit may kulay yan, alam nyo hindi. O, huwag tayo plastikan dito, B. Huwag tayong plastikan dito, B. Ha? O, diba? O, screen cap nyo muna. O, next. This type of abnormal labor is associated with your cephalopelvic disproportion or fetal malposition. Michelle, 38 years old, Nalipara, is experiencing prolongation of labor due to her cervix failing to occur at least 1.2 cm per hour. Okay? She has been active labor for more than 13 hours and is what they call the protracted active phase, which point in the graph illustrates the abnormality. Tamang sagot dito. Dadaanan ko lang to Okay? Letter boy. Point C. Okay, point C. Okay, point C. B. Sabi ko, mahirap siya explain to be honest. Okay? Carmina is worried about being still labor after 24 hours. According to her physician, her cervix still not yet ripened enough and has remained at 3 cm. Which of the following interventions would require the charge nurse to intervene when she observes that the student is attempting to do certain action? Tamang sagot. Ano kaya? Ano kaya yan? Siyempre, letter boy ka na. Okay, providing instructions. Okay, providing instructions. Okay, siyempre, ang gagawin mo kasi dyan, okay, ang gagawin mo dyan, okay, which of the five intervention would require the charge nurse? Siyempre, pa inumin mo naman ng tubig, matagal pa yan. Administering morphine sulfate, it's painful, pwede. Assisting the rate of oxytocin infusion, pwede. Diba? Letter dog. Okay? Ano yung providing instruction? Ano sasayaw yung student nurse? Sasayaw si student nurse. 'Di ba? Letter dog. Letter dog. Based on the graph and the situation which point illustrates type of abnormal labor. Ano kaya dito yung pinakamaganda yung hulaan? B, magdasal ka na. Anong palagi mo pinagdadasal? Letter? Anong letter? Letter C. Point B. Okay, point B. Ito siya. Ito na yung mga interpretation. Okay, interpretation ng iyong graph. Okay? At least, di ba, pangalan nyo lumabas sa board exam 2. A-assist lang naman kasi siya. A-assist lang naman. Di ba? With the guidance pa din naman. With the guidance pa din. Ay, charot. Sabi sa akin pagdaan mag-screen cap. Alam ko hindi niyo naman naaralin yan, B. Tapos bigla lumabas sa board exam. Wait lang. Sige, babalik ko sa colored ka. Sige, wait lang. Sabi sa akin kapag done na. Aaralin nyo ba yan? Aaralin nyo yung ganyan? Yes, now. Bukas. Di na. Talaga itong mga to. Ika na, dito. Ito. Move on na kayo. Hindi ako gumawa niyan, mabait ako sa inyo. Di ba, mabait ako magpa-exam. Madali ako magpa-exam. Next, andito tayo. Mirsol has been experiencing prolonged labor. What is the most common cause of arrest of descent during the second stage? Anong tamang sagot dito? Lumabas na siya kanina. Ano ba yung topic mo sa number 26? Ano yung topic mo sa number 26? So most probably yun yung sagot mo. Okay? Letter dog. Okay, cephalopelvic disproportion. Okay? Arrest of descent results when no descent has occurred for 1 hour and multipara for 2 hours or 2 hours in nullipara. Failure of descent has been occurred when expected descent of fetus does not begin or engage or movement beyond zero station has not occurred. The most likely cause of arrest of descent during the second stage is your cephalopelvic disproportion. Letter dog. Letter dog. 30, according to the graph and situation, which point illustrates the point of abnormal labor of Mirasol currently experiencing. Anong tamang sagot? Ang arrest mo is letter. Ano yung secondary arrest of dilatation? Letter C ulit. Okay, letter C. C for Christ. Point E. Okay? O next, ECG naman daw tayo. Hindi pa rin ako gumawa nito, promise. Golda, a new nurse in the labor and delivery department, knows that regardless of which unit she may be assigned, the importance of knowing the basics of ECG and EKG rhythm should be carried with her wherever she goes. Di pa rin ako to promise. In this rhythm, the nurse usually goes up to rate of 250 to 400 beats per minute. QRS complex may be uniform, but are often irregular in rate. What type of ECG rhythm is shown? Oh, ito. Di ba? Letter, okay, distinct ba dito ang iyong QRST wave? Yes, distinct siya. Kapag hindi distinct ang QRS mo, QRS complex mo, most probably nasa ventricular tachycardia. Ayan. Okay, so tanggalin mo si letter dog. It's either B or C na lang. A or C na lang talaga to. Atrial flutter or your atrial fibrillation. Tandaan nyo, kapag atrial flutter, okay, kapag atrial flutter, sawtooth pattern siya. Sawtooth pattern. Kapag atrial fibrillation ka, ano yan? Hindi na distinct, not distinct yung P-wave mo. Nakikita mo pa ba sila P-wave dyan? Yes or no? Ayan, ang dami nila. Oh, ano itsura nito? Ano itsura nito? Mukha ba siyang sawtooth? Yes or no? Mukha ba siyang sawtooth? Yes. Tamang sagot. Letter. Ano kaya? Letter apple. Apple. Atrial flutter. Okay, atrial flutter. Upon assessment of your patient who is currently undergoing, your patient complains of chest pain. She tells you that in the past she has been taking excessive amphetamines. What do you call this type of ECG reading? Ano kaya yan? O kapag ganyan, hindi yan sinus rhythm. Kasi tingnan mo, hindi yan sinusmatic. Bakit, sir? Bakit hindi siya nagiging sinus? First of all, tingnan mo yung distance ito sa distance nito. Tsaka yung distance ito, tsaka ito. Parehas ba? Yes or no? Parehas ba yung distance si 1 to 2 sa 2 to 3? No. Kailangan kapag sinus rhythm yan, parehas sila ng distance yung QRS complex mo. Okay? First degree AV block, prolonged ba siya? Consistently prolonged ba yung ano niyan? No. Okay, hindi yan first degree AV block. So it's either supraventricular tachycardia yan or premature junction or junctional junctions yan. Okay, your supraventricular tachycardia, dikit-dikit yan. Okay, dikit-dikit na ECG reading yan. And more than 120 yung ano, yung heart rate niyan? Tamang sagot, letter, ano? Letter boy. Okay, letter boy. Okay, letter boy. Oh, next. You are currently completing your charted documents when the telemetry monitor for one of your patients who had just given birth start to alarm. Upon checking, you see that the heart rate has gone up to 200 beats per minute. The ECG rhythm is as shown below. You see that the patient on bed, unresponsive. What should you do first? Anong kailangan mong gawin? Ano mo nang reading to? Ano mo nang reading to, B? VTAC. Okay? Ventricular tachycardia. Anong unang-una mong gagawin kapag nakakita ka ng ventricular tachycardia? Or nakita mo, VTAC yung patient mo, sisigaw ka ba? Yes or no? Sisigaw ka, magpapanik, mapapashit. Gaganon ka. Ano na mong gagawin? Siyempre, una mong gagawin is letter, ano kaya dyan? Letter dog. Reassess the patient. Bakit? Okay, kapag ventricular tachycardia yan, okay, pag ventricular tachycardia, possible ba may pulse si patient? Yes or no? Possible ba may pulse? Yes. Kapag pulseless VTAC ka lang, dun ka lang sa start ng CPR. Okay? Dun ka lang magsa-start ng CPR. Okay? Pero kung wire nakita mo yung patient mo, meron siyang pulse, pwede ka mag-initiate ng cardioversion. Okay? It would depend. Yes. Okay? Pero kasi dito unconscious yung unresponsive yung patient mo, possible yung mag-cardiovert ka agad yan. Ang best thing to do mo is to reassess the patient. Okay? How about your VFib? Ventricular fibrillation. May pulse or wala? Wale. Matic wale yun, D. Okay, wale yun. Which medication? VTAC. Okay, kapag VTAC po, kadalasan dalawa lang yan. It's either with pulse or without pulse. Kapag with pulse, meron pang other protocol. Yan, kadalasan kapag with pulse na VTAC, nagka-cardiovert dyan. Pero kung nakita mo walang pulse yung patient mo, CPR ka dyan. Okay, CPR ka dyan. Or shock. It's either CPR or shock. Kung ano mauna. Pero priority mo is i-shock yung patient mo. Pero in this case kasi wala naman nakalagay na nandyan na yung cart. Yung emergency cart mo. So CPR ka dyan. Yes. Masaya ang ACLS. Favorite ko siya. Next, which medication can be used for cardioversion? Okay. Your clopidogrel is an antiplatelet medication. Okay. Your adenosine is for what? Usually to sa mga SVT, supraventricular tachycardia with heart rate of 120 beats per minute. Okay? Your atropine is usually saan to? Yes, very good. Pag narrow. Okay, atropine, saan to kadalasan binibigay ang atropine? Bradycardia. Bradycardic patient. Correct answer is what? Letter apple. Amiodarone. Amiodarone. Number 35. May natama yung mga person. Yes, ay ang galing. Pwede maging ICU nurse. Patient Maricor is a high-risk patient admitted for ongoing labor and has history of your anterior wall MI. During the progression of labor, you see the rhythm of patient Maricor's telemetry monitor. What type of ECG is this? Tingnan nyo yung PR interval ni patient. Nagpo-prolong ba siya? Yes or no? Nagpo-prolong ba siya? Prolong ang PR interval niyan, yes. Diba? For sure yan, may AV block si patient. It's either second degree AV block, type 1 or second degree AV block, type 2. Ano yung nagpo-prolong tapos bigla mag-halt? That is your type. Ano kaya? Type 1. Okay. Ay, wala pong image sa inyo. Ano na lang type yan? O, nasabi ko na, anong type yan? Type 1 yan. Okay, type 1 yan. Kasi prolonging siya. Okay, kapag type 1, second degree, yes, bonus na po yan. Opo, bonus po. At lahat na kayo may score, yes or no? Lahat na may score? Yes. Masaya na. Di ba? Lahat may score. At least lahat naka-1. Di ba? Your second degree AV block is prolonging PR interval. And then, no PR na siya. Ito, constant PR interval. Constant, prolong, PR, and then stop. Yan ang difference silang dalawa. Next situation, Cassandra is a supermodel who recently gave birth and has been placed under your care in the OB ward in the Marauder Medical Center. She has just delivered a healthy baby boy who is currently in the nursery, allowing Cassandra to have some time for herself to recover and conserve energy for when her baby is again brought to her room sometime later today. Upon entering the room, you notice Cassandra standing in front of the mirror, looking sadly at her abdomen. She says, "Nurse, super fragilistic. My stomach still looks like I'm pregnant. Will I ever return back to my previous body? I can't go forever looking like this. I won't ever get bookings for Fashion Week ever again." Nurse super fragilistic explained that the abdominal muscle which separates during pregnancy will, tamang sagot. Ano yung tamang sagot dito? Letter ano kaya? Iba gusto niya mapabilis. Ang pinakamaganda dyan, yung pinakamaganda sagot dyan, since gusto niya kasi mapabilis, letter dog. Okay, letter dog, regain tone as soon as she exercises. Okay, kasi ang point kasi dito, gusto niya kasi bumilis. Okay, when the postpartum woman stands on the first day after birth, her abdomen protrudes and gives her a still pregnant appearance. Okay, for the majority of women, the muscle of abdominal wall will return state within 6 weeks with appropriate exercises. If you're a woman, and with appropriate exercises. So letter dog. Letter dog. Letter dog. Cassandra does not look impressed, though. She continues to pinch apart her abdomen and grimace at the sight of her stretch marks. She told you she tried to keep the stretch mark at the minimum, but she couldn't get the ones that were out of her reach. She asked you if it will ever go away. What should the nurse super fragilistic say? Tamang sagot. Ang tanong dyan, may treatment ba doon? Yes or no? May appropriate treatment ba dyan? Wala. According to the studies, wala pong appropriate treatment dyan. Wala. Okay? So, isasabihin mo ba siya na mag-hydrate siya na mag-hydrate? Pinapaasa mo ba yung letter C? Yes or no? Yes. Wala namang appropriate treatment po so far. X, letter C. Okay? Those stretch marks will totally disappear. Magto-totally disappear ba siya? Yes or no? No. Correct answer is letter apple. Don't worry, those stretch marks will fade to a lighter color eventually. Letter apple. Letter apple. On Mariela is assessed, ayaw nyo na, by nurse super fragilistic colleague. Nurse expedited the next calendar, the day after. Okay, vaginal delivery of a full-term newborn. She observed that Mariela's perineum and labia are edematous despite not having episiotomy or perineal laceration. In order to promote comfort, which action by the student requires additional teaching. So may mali dito. Natandaan nyo, okay, At tandaan nyo, kapag ganyan, after 24 hours, anong recommended natin? Warm or cold? So, X mo na to yung CND mo. Kasi it's either warm or cold na lang yan. Okay? Tanggal si letter C at letter dog. Okay? Kapag ganyan, kapag more than 24 hours na, okay? Kapag more than 24 hours, anong recommended mo? Warm or cold? It is warm compress. Okay, warm compress. Kapag less than 24 hours, ano siya? Doon ka magko-cold. Okay? Correct answer. O kaya, letter boy. Letter boy. Letter boy. Next. Nurse superfragilistic and nurse expeditious are assisting with the delivery of a newborn. Which interventions should they anticipate to prevent postpartum hemorrhage during the third stage of labor? Tamang sagot. Sure na kayo sa letter dog. Sure na kayo sa letter dog. Correct answer is letter. Advisable ba? Okay, advisable ba mag-fundal pressure? Yes or no? No. Ano ba yung third stage of labor mo? Ano yung third stage of labor? Placental delivery. So magde-deliver pala yung placenta. Hindi ka pa ba, magka-clamp ka na ba dyan? Hindi pa, B. Correct answer. Paano mo ba magpa-placental delivery? Your letter dog. Okay, letter dog. O, tama na. Okay. Yes. Yes, yan. Okay. Next. A nurse superfragilistic is giving a report to postpartum nurse on a client who's just delivered a newborn. And that's history of delivering baby at 22 weeks and triplets. Which number should nurse fragilistic prefer the client's parity? Tamang sagot. 38 is letter boy. Parity mo, anong sabihin definition ng parity? Definition ng parity. Definition ng parity. More than, ano? Pregnancy more than? B. Ano na? Ano daw yung parity? Parity is umabot sa viability more than 20 weeks. So, delivered a newborn, 1. Delivered at 22 weeks, 1. Triplets ba considered as 1 pregnancy or 3 pregnancies yan? 1. Correct answer is letter, ano? Anong tamang sagot? Letter boy. Ay, letter boy. Next. Dr. Aguilar, a PhD in nursing, has been appointed to be a consultant to help administration in coming up with strategies that will further enhance teamwork and quality improvement in the obstetric wards of Marauder Medical Center. The healthcare team has noticed an increased IV filtrations on the pediatric ward or pediatric floor. As a part of PDSA, quality improvement plan, the team should do which of the following? Okay, so ang pinakamagandang gawin mo dyan is what? Ano yung pinakamaganda mong unang gawin dyan? Letter? Fourth is letter boy. Letter apple. Decide to monitor the IV gauges. Perform chart audit. Analyze the data and write a new policy. Letter apple. Siyempre yung huli yan, write a new IV insertion policy. So X mo agad si letter B and C. Okay, X mo si B and C. So ano ba mas muna natin? Chart audit or analyze data? Mag-chart audit ka muna. So letter Apple. 42, Nurse Chloe is a member of a team that is planning a client-centered approach to care of clients with chronic obstructive pulmonary disease using the chronic care model. The team should focus on improving the quality of care and delivery in which of the following areas? Siyempre, pag ganyan, you are focusing on the community. Okay? Clinical information system and delivery system design, letter cat. Letter cat. Letter cat. (43) The nurse managers on the orthopedic unit is reviewing a report that indicates that in the last month, 5 clients were diagnosed with pressure ulcers. The nurse manager should, kapag ganyan, ang benchmarking, okay, 41 is letter Apple. Ang benchmarking is what? Comparison. Magko-compare ka ba sa other units? Hindi muna, B. Alamin mo muna. Benchmarking means comparison. Okay? Ang pinakamagandang gawin mo dyan is, ano kaya? Letter, favorite answer nyo, letter C. Okay, letter C. Institute a quality improvement plan that identifies contributing factors. Kasi matatanong mo na din yung letter B and letter DOG. That is your CQI, continuous quality improvement and plan that identifies contributing factors, proposes solution, and set improvement outcomes. Letter CAT. 44. The registered nurse instructs the new nurse that the variance analysis is performed on all clients with respect at which time frame. Tamang sagot. Ano kayong pinakatamang sagot dyan? Letter. Ano kaya? Letter Apple. Continuously. Ay, continuously mo kasi siya. Letter Apple. 42. 44 is continuously. (45) A client is admitted for a coronary artery bypass graft with anticipated admission to the coronary care unit. In preparation for the client's admission to the hospital, which action will best predict the sequence of timing of care and direct the course of client's hospital stay? Tamang sagot, in order po kasi, order yan. Letter, ano kayong pinakamalalim na sagot dyan? Okay, letter Apple, ang implementation for clinical pathway, ito yung mga expected. Okay, expected na course. Okay, kumari, your for example, a sickness of laparoscopic cholecystectomy. Ang expected niya, dapat ganyan time makauwi na siya, dapat ganyan time makauwi na siya. Parang pinipredict mo siya. Ipipredict mo kung hanggang ilang hours, hanggang ilang days lamang stay yung patient mo. Letter Apple. Yes. Letter Apple. Patient M is a 42-year-old pregnant client who is rushed to the emergency room with suspected acute pancreatitis. Her blood pressure is 140/80, pulse rate of 98, RR of 23, and temperature of 38. Upon checking her past medical records, it has been found that includes hyperlipidemia and alcohol abuse. Nurse Rachel is then assigned to patient M. Nandiyan na yung tamang sagot. Once the patient has been stabilized and has been admitted to the medical surgical unit, the nurse or the doctor prescribed nasogastric tube. Before inserting the tube, nurse explained that the purpose to the patient. Which of the following is the most appropriate explanation? Diba? BS, naka-bold na yung tamang sagot. Tamang sagot? Naka-bold na yung tamang sagot. Letter C. Okay, letter C. Naka-bold na yung tamang sagot. Hindi ko lang natanggal yung pagkaka-bold. Okay. Nasogastric suction may be used to relieve the nausea and vomiting and to decrease painful abdominal distension and your paralytic ileus. Letter C. Okay, letter C. 47. Nurse Rachel is reviewing the physician's order for her patient diagnosed with acute pancreatitis. Which physician order should the nurse question if noted on the patient's chart? Okay? B, nag-insert ka na ng NDT, X mo na to. Nag-NPO na siya kasi may ileus. Anong tamang sagot? A, C or D? Ano kaya? Your anticholinergic medication is an antispasmodic drug. Okay, para mag-prevent ng spasm. Ang morphine mo is to address sa pain. Ano kayang tamang sagot dito? Ano kayang tamang sagot? Letter, ano kaya? Letter cat. Morphine sulfate. Bakit? Ang tendency kasi ng morphine sulfate nagkukos pa siya ng spasm on the sphincter of OD. It can cause spasm kasi. Diba? So ang gusto mong ano ibibigay mo? Your meperidine or your Demerol. Okay? Ang mas preferred mo is meperidine or your Demerol. Letter cat. Okay? Hala, napapa-thank you, Lord. Next. During the follow-up of her patient's laboratory results, which of the laboratory should expect abnormal for patient M? Kapag cardiac enzyme, nagka-cardiac arrest to for the heart problems. Your ALT, AST, saan to? Saan commonly elevated ng AST, ALT? Liver. Saan common elevated ang K at BUN? Sa kidney. Tamang sagot, letter boy. AST, ALT. Charot. Letter dog. Letter dog. Wala. Nagalit na naman sila. Letter dog. Galit na naman ang mga person. Next. Diyan nandidilim yung paningin. B, baka may himatay ka na kaya nandidilim yung paningin mo. Hypoglycemia na yan. Nurse Rachel is assigned another diagnosed with chronic pancreatitis. The nurse administered prescribed medication called pancrealipase. Which observation best indicates that the treatment for this patient is effective? Okay, your pancrealipase kasi promotes what? Anong ginagawa mo niyan? Digestion of your protein, fat, and carbohydrates. So, kadalasan po binibigay ang before meals. Okay? Before meals. X to. Okay? Patient loses more than 10 pounds. Ang expected mo ba mag-lose siya kapag naka-pancrealipase? Yes or no? No. Dapat mag-gain weight pa siya. X din to. Digestion of your protein fat pa siya. Okay natin. Yan. Kapag nag-ano ka niyan, yung stools mo ba magiging mas fatty ba siya? Yes or no? Yes. Okay. At increased frequency yan kasi nag-digest ka. X to, tamang sagot, letter dog. Okay? Letter dog. Kasi bakit? Para sabang protein, fat, and carb digestion mo sa skin, di ba? So magiging maganda yung skin mo pag ganyan. Ang layo ng ratio, di ba? Letter dog. Okay, letter dog. Di ba? Ang layo, di ba? Sabi yan ng yan yung sagot eh. Yan yung sinabi ng book. Di ba? Sinabi ng book. Anong gagawin natin, B? Di ba? Sabi ng book. At tayo magagawa. Sabi ng libro yun. A student nurse is preparing a teaching care plan to a pregnant to help improve the nutrition of her assigned patient with achalasia. Ang achalasia may problem when it comes to your esophagus. Di ba? Esophagus. Kapag may problem sa esophagus, pwede ba siyang anong tamang sagot dito? Paano papakainin? Letter cat. Okay, letter cat. Okay, letter cat. Situation. Multiple endocrine neoplasia men 1 is a hereditary disorder in which one or more of the following glands develop excess normal tissue, hyperplasia, and adenoma. The parathyroids. Hindi ako gumawa nito, B. Hindi ako to. Sasabihin ko kapag ako yung gumawa. Pero hindi ako to. Promise. Oo. The adrenal and thyroid gland. These are all endocrine glands which produce the secrete hormones into blood and lymph system. Gusto nyo ganyanin ko na lang yung pre-boards 2. Ganyan na lang yung pre-boards 2. Ano ba gusto nyo? Mas mahirap, mas madali. Pre-boards 2. Mag-walk out na. Okay. Student nurse Capybara is aware that there are several forms of multiple endocrine neoplasia. Which of the following is not included to your MEN syndrome? Tamang sagot. Ang MEN syndrome mo, syempre meron niyang MEN 1A, MEN 2B, MEN 4, at saka hindi kayo meant to be sad. Letter boy. Okay, letter boy, walang MEN 3C. Okay, walang MEN 3C. Letter boy. Di ba mali na naman? Merong meant to be, Ito yung forms ng mo. Ito yung mga forms. So yung malaman, ito yung mga form. Ayan. Pero yung pre-boards 2 kasi inaaral ko na yung pre-boards. So madali yung pre-boards 2. Madali yung pre-boards 2. Ako nagsasabi sa inyo. Promise. Madali ang pre-boards 2. Inaaral ko na yung pre-boards 2 eh. Madali yung promise, madali. Hindi ko kayo pinapaasa. Madali pre-boards 2. Ay, tingnan nyo. Charot. Meron sa next next window ko. Ay, next window ko. Nandun yung pre-boards 2. Next window. Opo. Oo nga, madali nga. Promise. Promise, madali siya. The following conditions can be found under the category of MEN 2A except leakage? Bawal leakage B. Pag na-perfect nyo ang pre-boards, lagot tayo. Ang tamang sagot dito. Pag natama nyo to, papakita ko. Ano daw yung mga MEN 2A? Tamang sagot. Anong tamang sagot? Mali na agad. Mali. Hindi papakita yung pre-boards 2. Tamang sagot, letter boy. Okay, letter boy. Marfanoid. Okay, marfanoid, body habitus. Mali yung unang sagot eh. Letter dog yung unang sagot. Masauna si John. Letter boy. Ano pa yung other manifestation ng MEN 2A? Ano pang other manifestation ng MEN 2A? Ano pa? Dali. Identify kahit isa lang manifestation ng MEN 2A. Starts with letter, Ito na siya, B. Okay, ito na siya. Ito yung mga manifestations mo. MEN 1, MEN 2A, MEN 2B. Sige, screen cap nyo na lang. For sure, hanggang screen cap lang yan, B. Hanggang screen cap lang gagawin dyan. Amen. Screen cap, tapos nakastore sa phone. Para kung wire, nag-aaral. Pag sinilip ni mama mo, ay, nag-aaral ka, anak. Next. Common symptoms under the syndrome include, ano kaya? Common symptoms may letter apple, bloated feeling after meals, unintentional weight loss, and loss of axillary and pubic hair. Letter apple. Dadaanan ko lang yung mga kasi mga rare syndromes sa mga to. So most probably wala. Dadaanan ko lang. Okay? Except kasi siya, yes, except lang siya. Wala siyang Marfanoid body. Andun sa ano, wala siyang Marfanoid. Yes. Nurse Christine from the medical surgical unit was asked to float to orthopedics in which she has no experience working on, which client should be assigned to her. Okay, kapag ganyan, yung mga float na ganyan, yung kadalasan mong ibibigay sa nurse, yung pinakamadali at yung ready for discharge. Okay, ready for discharge. Diba? For example, ito, balance skeletal traction na kailangan ng assistance. Feeling mo ba trained siya niyan? Yes or no? No. Diba? Baka mabalian pa yan. Above the knee amputation yesterday, febrile pa. That is a complication, diba? Cast fractured humerus experiencing numbness and discoloration of fingers. Most probably compartment syndrome ba to? Yes or no? Compartment syndrome, yes. Pinakamagandang gawin mo dyan yung nagmo-monitor ka na lang ng blood sugar. Letter dog. Okay, letter dog. Letter dog. A newly graduated RN was assigned to Nurse Christine during her second week of orientation. Which patient would the nurse assign to the new RN who are under her supervision? New diagnosis of pancreatic cancer, complicated to be X mo to. Okay? Tracheostomy, need tracheostomy care. Competent ba kayo gumawa mag-tracheostomy care? Yes or no? Competent ba kayo mag-tracheostomy care? Yes or no? Competent ba mag-tracheostomy care? Yes or no? Hindi tayo sure. Pero yes, you are competent. Okay, competent tayo dapat mag-tracheostomy care. Okay, a 6-year-old with lung cancer who had just undergone left lower lobectomy, X, to unahin mo yung pwede ma-discharge. Tamang sagot, letter boy. Letter boy. As a newly graduated nurse, you are required to attend seminars regarding CPDS and in-service training by the tertiary hospital you are working in. You and the other staff nurses attend a seminar that talks diabetes medicine in order to provide further improved holistic nursing care for diabetic patients. Nurse Saris has a basic understanding that which of these pancreatic cells in the islets of Langerhans secrete glucagon. Okay? Ano daw yung ano? It's either alpha, beta lang yan. Anong tamang sagot? It is letter dog. Alpha. Ano yung beta? Ano si secret ng beta? Insulin. Very good. Insulin. Again, alpha is glucagon. Beta is your insulin. Nurse Sarah administered glucagon to her diabetic client, then monitors for adverse reaction and interaction. Nurse Sarah is correct when she identifies which drug as one that reacts adversely with glucagon. Tamang sagot. Ano kaya? Adverse reaction, letter apple. Letter apple, nakakatakot siya. Oral anticoagulants react adversely with glucagon because it increases its anticoagulant effect. Letter apple. In caring for patients with type 1 DM who exhibits confusion, lightheadedness, aberrant behavior, but still conscious. Okay, what should the nurse first administer? 58. Tamang sagot. Letter. Magbibigay ka pa ba ng insulin dyan? Hypogly ba yan nangyayari? Yes or no? Hypogly yan B. Ano pinakatamang sagot? Letter. Ano? Cat. Kasi conscious pa siya. Paano pag unconscious? Ano bibigay mo? Your IV bolus of dextrose 50%. Okay, IV bolus of your dextrose 50%. Yes. Okay. As the physician writes an order prescribing an oral hypoglycemic agent, glipizide, for a male client with type 2 BM who has been trouble controlling the blood glucose level through lifestyle change involving diet and exercise. Which medication instruction should the nurse provide? Ang glipizide mo, hindi siya nakakababa ng sodium. Take glipizide after meal. Ano ba mas gusto mo? Before or after meal? Kapag yung mga ganyan, before meals. Tamang sagot, letter, So check ka pa, kailangan mo ba mag-check pa ng blood glucose kapag mag-glipizide ka? Yes or no? Kailangan ba mag-check? Yes. Tamang sagot, letter apple. Letter apple. The nurse is providing discharge instruction to a client who has been recently diagnosed of your DM. The client's glycosylated hemoglobin is at 10%. Mataas or mababa ang 10%? What should the nurse inform the client? Mataas, mababa yan? Mataas yan. Okay? Change the time of the day you exercise because it may cause hypoglycemia. Mag-hypoglycemia pa ba yan? Sa taas ng blood sugar niya, hindi na mag-hypoglycemia. Same diet pa ba yan? Ang normal mo, dapat hindi siya aabot ng 6. Okay, alam ko hanggang upper limit mo lang 5.6. 5.6 ang upper limit mo. Okay? Continue same diet pa rin ba yan? Yes or no? Continue same diet? No. Kailangan na yan mag-modify. Okay? Decrease carbohydrate consumption. Ang tendency nito, possible ba siya hypoglycemia? Kapag ganyan, yes. Correct answer is letter apple. Letter apple. Okay, letter apple. Okay? Nurse Chinky provides an education about beginning oral hypoglycemic therapy on patient awaiting for discharge. Gusto niyo ba mag-break? Or tapos natin yung 100 items? Or gusto niyo na mag-break? 10-minute break. 10 minute. Or tapusin. Tapusin ng 100 na lang. Tapusin ng 100 na lang. Okay, tapusin natin ng 100. Okay. Which statements, if made by the client, indicate need further teaching? Tamang sagot. Ano kaya dito? Letter C. Okay? If I feel sick, a dose is important. Hindi mo kailangan skip. Hindi mo kailangan mag-skip ng dose. Okay? Overeating is doubling my medication. Hindi rin po. Maintain lang. Wala naman sila doktor. Okay? If I become pregnant, I should discontinue. And your oral hypoglycemic medication have few side effects. Letter cat. Okay, letter cat. 62. B pa, nagkamali pa kayo dito, B. Sampal. The client is due to receive alprazolam, Xanax, 0.5 mg per RM, but the patient adamantly refused to receive medication. Instead of accepting the patient's decision, the nurse tells him, if you don't drink this right now. Sige. 62 pa lang tayo, B. 62 pa lang tayo. 62 pa lang tayo. I'll stick down to your throat. What can be the nurse liable for? Tamang sagot. B. Sure, nakaisa letter apple. Sure na sa apple. Yes, letter apple. Apple. 61. Next, Nurse Archie is an adult intensive care unit nurse. He should be aware of the medications that are commonly given to his patient. Furthermore, he should be knowledgeable on ACLS. Ito na po, ako na po gumawa nito. Saya-saya kaya nung ginawa kong topic. Ito, start dito, ako gumawa nito. Nurse Archie is about to give discharge. Instruction to a patient Lano who suffered congestive heart failure One of the take-home medications is digoxin. Nurse Archie is aware that the mechanism of your lanoxin is tamang sagot. Ano kaya yan? Ano muna yung dromotrophic? Ang dromotrophic is, ang ginagawa nito is slows the conduction of the heart, of the AV node. Okay? Your chronotropic is for your slowing the heart rate. Okay? Your inotropic is increases contraction of the heart. Sonotropic is, ano yung sonotropic? Invento lang po. Correct answer is, ano bang ginagawa kapag lanoxin? Di ba bumabagal ang heart rate? Bumabagal ang heart rate, letter boy. Okay? Letter boy. Okay, letter boy. Digoxin increases which intracellular electrolyte by inhibiting sodium-potassium ATPase. Tamang sagot. Saan tayo sagot nyo dito? Potassium. Saan tayo sagot nyo potassium? Saan tayo? Sure ako dyan, sagot nyo potassium. Tamang sagot, letter C, calcium. Okay, calcium po. Calcium. Next, after discharging patient Lana, he admitted Pamela, who is post-resuscitation. Her mental status declares her to open her eyes to pain, uses incomprehensible sounds since he is intubated and withdraws her pain when pain is inflicted to his arm. She has an indwelling catheter of a central venous catheter or access on the right arm. IV drips into dopamine and dobutamine. The following are the mechanism for dobutamine except, ano kayang tamang sagot dito? So your dobutamine increases your cardiac output, increases your heart rate, and increases your contractility, but it decreases your systemic vascular resistance. Letter cat. Letter cat. Number 66. Nurse Archie noticed that Pamela developed monomorphic stable ventricular tachycardia. He knows that he should prepare lidocaine at the bedside. Lidocaine is an example of your class 1B of anti-dysrhythmic drug. The mechanism of action of your class 1B drug is, tamang sagot, ano kayong tamang sagot dito? Letter apple. Apple. Okay? Apple. Your black sodium and delays repolarization and lengthening the duration of the action potential is what? Class 1A. Okay? Yung Purkinje system naman is your class 1C. Okay? Your blocks your beta receptors is your class 2. Yan. Number 67. Nurse Pamela went to cardiac arrest. According to the American Heart Association, the 5H and the 5Ts that are reversible causes of your ACLS, which of the following is part of your 5H and 5Ts? Tamang sagot. Anong tamang sagot dito, B? Letter. Ang ACLS mo kapag nagka-cardiac arrest. Okay? Hypovolemia is the cause of your cardiac arrest. Hypokalemia is a part of your cardiac arrest. A or B? It is letter boy. Hypercalcemia. Ano ba yung 5H mo? Ang 5H mo is your hypovolemia, hypoxia, hydrogen ions, hyperkalemia, and your hypothermia. Okay, we are looking for the except. Yung 5 T's mo naman, ito yung 5 T's mo. Yan. O numbers, charot, situation. Heart failure occurs. Yun lang yung hyper. Di ba? Hindi naman. Hindi kasi siya. Kasi tawag dito, it's not part of your, yes. Yun din yung sinagot mo kasi siya lang yung hyper. Heart failure. Ang cute. Okay, heart failure occurs when the cardiac output is inadequate to provide oxygen needed by the body. It is highly lethal condition with 5-year mortality rate. Convention is said to be about 50%. Treatment is therefore directed at two somewhat different goals: reducing symptoms and slowing progression as possible during relatively stable periods, and managing acute episodes of decompensated failure. Which of the following is combined your alpha and beta agonist? Ano kaya dyan? Letter combination, that is your letter dog, carvedilol. Okay, carvedilol. Letter dog. Okay, letter dog. Next. Furosemide is administered intravenously to a client with heart failure. How soon after administration should the nurse begin to see evidence of desired effect? Ano bang desired effect mo kapag furosemide? Anong desired effect natin kapag furosemide? Ano expected mong i-assess mo post-furosemide? Increased in UO after ilang minutes? Letter. The correct answer is letter apple. Okay, apple. After IV injection of your furosemide, diuresis normally begin about 5 minutes. So letter apple. Opo. How soon kasi siya? How soon? 5 to 10 minutes. Letter apple. Kenneth was admitted for myocardial infarction. MI develops cardiogenic shock. An anterior line is inserted. Which of the following order should the nurse question? Tamang sagot. So kapag ganyan, di ba? Call for UO less than 30 ml for 2 hours. Yes. Okay. Yes, yan. Titrate dobutamine to keep systolic more than 100. Yes. Okay. Nagka-cardiogenic shock na siya. Ang metoprolol mo ba nakaka-increase or nakakababa ng BP? Nakakababa. So magbibigay ka pa ba ng metoprolol? No. Correct answer, letter. Anong tamang sagot? Letter cat. Okay, letter cat. Okay, letter cat. Next, Kenneth has been taking several medications, including furosemide, digoxin, and potassium chloride. The nurse or the client has nausea, blurred vision, headache, and the weakness. The nurse notes that the client is confused. The telemetry strip shows first degree AV block. The nurse should assess the client for signs of which of the following condition? Tamang sagot. Ano kayong tamang sagot? The correct answer, okay? Blurred vision. Okay, blurred vision. Okay. Nausea. Okay. Ano kaya yan? Correct answer is letter boy. Okay? Letter boy. Letter boy. Okay? Letter boy. Digoxin toxicity. Opo. Yung fluid volume deficit mo kasi, anong cues mo ng fluid volume deficit dyan? Ano yung cues mo ng fluid volume deficit dyan? Wala. Wala tayong cues ng fluid volume deficit kasi dyan. Na sobrang evident na fluid volume deficit. So matik, tanggal na yung all of the above mo. And nagbo-blurring of vision siya. Di ba blurring of vision is a classic sign of your digoxin toxicity. So letter boy. Gemma is known to be hypertensive. She is taking clonidine if her blood pressure is shooting up to 200 by 120 millimeter mercury. You as a competent nurse should teach Gemma the following common adverse effect of clonidine. Select all that apply. Expected mo, okay, ang clonidine mo, for sure nag-all of the above, pero X ang all of the above. Okay? Correct answer is letter C. Letter C. Dry mouth, impotence, and your sleep disturbance. Letter C. Alam niyo yung tamang sagot dito? Alam niyo yung tamang sagot? Ay, opo. Galing. Okay. Next. Client with heart failure is prone for atrial fibrillation. During the physical examination, the nurse should suspect atrial fibrillation when palpation of radial pulses reveals, ano kaya yan? A pulse rate below 60 is an example of what? Bradycardia, yes or no? Bradycardia yan, B. Eh yung weak thready pulse, ano kaya yung most probably yan? Pwede ba in shock na yan, yes or no? Yes, pwedeng in shock na yan. Correct answer is letter apple. Letter dog, sorry. Letter dog. Ay, letter boy. Ano ba yun? Nalilito na ako. Letter boy, an irregular pulse rhythm. Okay, your letter apple kasi is your example of your premature ventricular contractions, PVCs. Lutang na tayo, B. Okay, lutang na. Okay, PVC. Letter boy. Pagod na ang purse. Kaya pa. Pero nalulutang na ako sa mga tanong. Nakalutang yung tanong kaya. Diba? Yes. Oh. A 10-year-old girl named Sarah, history of poorly controlled asthma, presents to the emergency department with shortness of breath, audible inspiratory, expiratory wheezing. She is pale, refuses to lie down, and appears extremely frightened. Her pulse is 120 beats per minute and respiration of 32. Her mother states that Tara has just recovered from a mild case of flu and seemed comfortable until this afternoon. Asthma is identified as disease with the triad physiologic process, except tamang sagot. Alam ko sagot nyo dito, letter boy. Alam ko sagot, letter boy. Sagot nyo. Letter boy, di ba? Tamang sagot, letter dog, airway tightness. Okay? Asthma is identified as disease with the triad physiologic process, airway inflammation, edema, and airway hyperactivity. Letter dog. Okay? Letter dog. Alam ko yung expected answer sa hindi. B. Okay, next. While receiving adrenergic beta-2 antagonist drug for asthma, Tara complains of palpitations, chest pain, and throbbing headache. What is the appropriate nursing action? Ano kaya yung tamang sagot dyan? Letter B and C, X to. X to. Okay. Your alpha, your adrenergic beta at 2 agonist ay kadalasan nagkukos ng tachycardia, 'di ba? Toxic effect kasi 'yan, 'di ba? Toxic effect 'yan. So letter apple. Withhold the drug until additional orders are obtained. Letter apple. Letter apple. The wall of the larynx is composed of 9 pieces of cartilage. 3 occur in single, and 3 occurs in pair. Of the paired cartilages, the blank cartilage are the most important because it influences changes in position and tension of the vocal folds. It is also known to be the triangular pieces, mostly hyaline cartilage located in the posterior border of the cricoid cartilage. Anong tamang sagot dito? Tamang sagot? Tara sa Cavite. Oy, malapit ako sa Cavite. For sure, sinagot nyo dito letter E para maiba yung sagot. Tamang sagot, ang layo mo, letter apple. Arytenoid. Okay, letter apple. Okay, next. After a while, Tara developed difficulty of breathing accompanied by hypotensive episodes. Dr. Devi decided for that Tara is for intubation. Nurse Tara is aware that rapid sequence intubation is a 7-step process that is often used to intubate the critically ill patient. It is considered safer for the patient as it decreases the risk for aspiration. The second step is, ano second step mo dyan? Tama, sure. Letter, ano ba yung pagkatas ng letter A? Letter B, pre-oxygenation. Ano ba yung proper sequence of your intubation? Ito siya. Gold standard in knowing the position of your ET tube. Gold standard to know the placement of your ET tube. Ano kaya? X-ray. Very good. X-ray. True. Sulit sa top rank. Diba? Next. Which of the following intervention would be most likely to Tara in developing the respiratory distress? Tamang sagot. Interventions mo dapat ano kaya? Di bata pa lang yan. Wag mo tuturuan mo na ba yung mag-smoking cessation, bata pa yung bata, B. X mo na to. Okay? Hypercap niya, ang taas ng CO2 mo, X mo to. O, anong pinaka mas gusto mo? Ang ARDS kasi wet lungs. Okay, wet lungs. Anong tamang sagot dito? Letter dog. Okay? Replacing fluids adequately during hypovolemic states. Letter dog. Next, Tara later on developed acute respiratory distress syndrome. Tara's peak pressure and spontaneous respiratory rate are increasing and the PO2 is not improving. Agitated yung patient mo kapag ganyan ang MEC vent mo. Okay, using the SBAR technique for communicate. The nurse calls the patient with the recommendation for ano kayang tamang sagot dyan? Sabihin yan, okay, kapag ganyan, nilalabanan ng patient mo yung MEC vent. So kapag nilalabanan niya yung MEC vent, mas gusto mo ba siyang patulugin? Yes or no? Gusto niya ba silang patulugin? Yes. Okay, mas gusto mo silang patulugin. Tamang sagot. Letter, suntukin. Grabe naman yung suntukin. Letter, apple. Initiating IV sedation. Pero true yan, kung pwede lang suntukin ng mga patient na para tulog sila. Letter, apple. 80. Yung gumawa daw ng, oy, grabe naman. Gumawa ng pre-boards, susuntukin. Hoy, invite. Ang dali-dali na nga niyan ginawa ko eh. Madali yan, promise. Promise, madali yan. Madali na yan. Sobrang dinalian ko na yan. Sobrang dinalian ko na yan as in. Isa na yung pinakamadaling nagawa kong pre-boards. Okay. A number of methods can be used to wean Tara from the ventilator. There are 3 main methods for weaning the T-tube, SIMV, and your pressure support ventilation. The mechanism of your T-tube is, so tanggalin mo na to. Okay, tanggalin mo na yan. Tanggalin mo na to. May mga MEC vent pa yan. Ang T-tube mo kasi tatanggalin mo yung patient, tapos itatry mo siya huminga mag-isa. Letter apple. Letter apple. Letter apple. Letter apple. Sympathectomy is a type of minimally invasive procedure which involves cauterizing a portion of the sympathetic nerve chain that runs down the back inside of the chest parallel to the spine. After bilateral lumbar sympathectomy, Jack has a sudden drop in blood pressure. There's no evidence of bleeding. What should nurse then identify as the most likely cause of the change in blood pressure? Anong tamang sagot dyan? Anong tamang sagot dyan? Oh, change in blood pressure. Okay, correct answer is letter dog. Reallocation of the blood supply. Paano nyo nalaman? Paano nyo nalaman na recalls? Recalls. Letter dog. Next. While convalescing from sympathectomy, a client develops thrombophlebitis. Which clinical indicators of this complication should nurse expect to identify when assessing JECA? Pain in the calf. Kapag yung thrombophlebitis ba, may masakit ba sa calf? Yes or no? Yes. Intermittent claudication, expected or arterial to? Arterial to be. Arterial to. Okay. Redness in the affected area, yes or no? Redness. Yes. Okay. Pitting edema on the lower leg, yes or no? Pitting edema in the lower leg, yes or no? Feeling nyo, pitting edema of the lower leg, yes or no? Ano kaya? Pitting edema of the lower leg? The correct answer is no. Okay? Hindi siya pitting edema, but it is swelling of one side of the leg. Okay? Ekisto. Ecchymotic. Hindi rin siya pasa. Yan B. Correct answer, letter boy. Letter boy. Okay, letter boy. 83. Nurse then is teaching a client about the use of your anti-embolism stockings. What instruction should the nurse include? Kapag nag-on and off ka nito, ang tendency mo masasanay. Ikis mo to. Wear the stockings. Di ba dapat naka-stockings ka whole day? Ikis mo to. Na pag may activity ka, leave stockings in place. Okay, correct answer, letter C. Put the stockings on before getting out of the bed in the morning. '84. Hello? Dr. Joshua orders high embolism stockings for a client with varicose veins. JECA's ties are heavier than the lower legs, and the stockings fit on the lower leg but are causing discomfort and indentation on the upper thigh. So, ibig sabihin masyadong malaki. What should the nurse do? Kapag naglagay ka ng knee-high, mai-impede to. Impede to B. Okay? Leave the anti-embolism stockings off to prevent tissue damage. Mas lalo siya magkakaroon ng ano. Roll the top to the below of the knees. Same answer with letter C. Ang best answer mo is letter dog. Letter dog. As the healthcare provider, if an elastic bandage can be used in place of the stockings. Letter dog. Letter dog. JECA is receiving a continuous intravenous infusion of heparin, 1,000 units per hour. There are 25 units of heparin in 500 ml dextrose solution. How many ml per hour should the nurse set the rate of the electronic infusion control device with a stock dose of 5,000 IU per 3 ml? Tamang sagot. Ano kayong tamang sagot dyan? Ratio and proportion. Okay, pinakamaganda dyan is ratio and proportion. Okay? So, ang kailangan mo, okay, is 1,000 units per hour. Divided by 25 units per hour, okay, is equal to desired ml mo over the stock was 500. Okay? Ganito po siya. Correct answer is letter dog. Okay, letter dog. Screen cap nyo muna. Explain ko sa inyo. Screen cap muna. Done. Next, eto siya. So, ang desired mo is 1,000. Okay, yung half mo is 25,000 units. Ilan ba yung ml per hour mo? X divided by 500. So, 25,000 X is equal to 1,000 times 500 is equal to 25,000. X is equal to 500,000. Divide mo silang dalawa ng 25,000 is equal to 20 ml per hour. Letter dog. Nakuha niyo yung sagot dyan? Hindi. Yes, ang galing. Next. Nurse Ganda is studying pharmacology in preparation for her nursing licensure exam this May 2023. The following questions apply. Which instructions should the nurse Ganda include in teaching you plan for a client who will be taking simvastatin, Zocor, when discharged? Select all that applies. Tamang sagot. Kapag ganyan, take the medication at least half hour before meals. Tinitake mo yung medication mo, at bedtime, X to. Okay, X to. Okay. Increase dietary intake of potassium. Wala pong effect ang potassium mo. Okay. Correct answer, letter boy. 2, 3, and 5. Bakit sir kailangan ophthalmic exam? Kasi ang tendency niyan, pwede siya magkaroon ng glaucoma or cataract. Okay, pwede siya magkaroon ng glaucoma or cataract. Letter boy. Number 87, amlodipine, Norvasc is prescribed for a client with hypertension. Which response to the medication should the nurse instruct the client to report to the healthcare provider? Tamang sagot. Ano ang tamang sagot dyan? Letter. Siyempre doon ka na letter dog. Okay, letter dog, difficulty of breathing. Masaya ba pa na yung pharmacology? Masaya pa na yung pharmacology? Ayaw nyo? Masaya kaya pa na yung pharmacology? Masakit sa ulo. Kasi walang pharmacology na sinabi sa amin. So, nilagay ko. Okay. Next. 88. Nurse Ganda knows that the renal dose of your dopamine is at. Tamang sagot. It is your. Ano kaya dyan? Tamang sagot. 88. Nurse Ganda knows that the renal dose of your dopamine is at. Letter. Ano kaya? Letter dog. 2 microgram per kilogram per minute. Okay? 2 microgram per kilogram per minute. Number 89. Dr. David has just started nasal packing for a client with epistaxis. The client is taking enalapril for hypertension. What should the nurse instruct the client to do? Meron bang nasabing aspirin dito, B? Meron bang aspirin? May sabi bang aspirin dito? Wala. Walang nasabing aspirin dito. B, tanggalin mo na yung letter apple. Omit the next source of enalapril. So, ang tendency kapag nagtanggal ka ng enalapril, tumataas ba yung blood pressure mo? Yes or no? Tataas yung blood pressure mo? Yes. Okay, mas lalo ba magbi-bleed na magbi-bleed? Yes or no? Yes. Okay. X to. Pinaka-best answer dyan is letter C. Avoid rigorous exercise. Letter C. Number 90. A client with acute chest pain is receiving IV morphine sulfate. Which of the following results are intended effects of the morphine in this client? Tamang sagot. Matik, wala po dyan all of the above. Okay, next to. Reduce your myocardial consumption. Yes. Okay, promotes reduction in respiratory rate. No. Okay, hindi po. Prevents ventricular remodeling. Hindi rin po. Okay, reduces the blood pressure and heart rate. Reduces anxiety and fear. Correct answer, letter cat. Letter cat. Letter cat. Ito, hanggang dito lang yung sa exam ko. Yung dito, hindi na ako to be. Okay? Situation, student nurse Mike is studying for the upcoming board exam. He is studying with his best friend, Queen, who seems to be focusing more on immunology concepts at time. The following questions apply. Once produced, an antibody is released into the bloodstream and carried to the attacking organism. There, it combines with the antigen, binding it with it like interlocking piece of a jigsaw puzzle. There are 4 well-defined stages of your immune response in its proper order. Tamang sagot dito, B. Ano kaya? Ano pinakamaganda? Tanggalin mo tong response. Okay, tanggalin mo tong response. Kasi ang response mo most probably nasa sa pangatlo pa yan. Tamang sagot, letter apple. Recognition, proliferation, response, and effector. Letter apple. May letter apple. Tama kayo doon? Tama, B? Tama? Ay. The following can be identified as a numeral response except, ano daw yung ano dyan? Naging pusa na siya. Okay, your numeral response include your bacterial phagocytosis, anaphylaxis, immune complex disease. Ito siya. Ayan. Ayan ang numeral response mo. Ang cellular response is this one. Tamang sagot, letter cat. Letter cat. Okay, letter cat. Number 93. Student nurse Ken confidently shares information about interferons. He cannot tell this information about except, ano hinahanap mong tamang sagot dito? Tama or mali? Ano hinahanap mong sagot? Tama or mali? Positive kasi meron siyang negative plus negative. Tamang sagot, it is your letter, ano kaya? 93's letter apple. Letter apple. Interferon is a non-specific virucidal protein that modify the immune response by suppressing antibody production and cellular immunity. Ano yung letter Letter boy. Colony, stimulating factors. Yung letter C mo is your monoclonal antibodies. And your letter T po is tumor necrosis factor. Yan. Pinakamahaba yung sasagot. True. Okay. Number 94. During the acute exacerbation, a patient with SLE is treated with corticosteroids. The nurse would expect the corticosteroid to begin tapered when which of the serum laboratory results are evident. Tamang sagot. Ano kaya yan? Letter. Ano kaya dyan yung nag-decrease? Letter apple, decrease anti-DNA. Kapag nag-decrease ang anti-DNA mo, magti-taper down ka na ng corticosteroids. 95. SLE is an inflammatory autoimmune disorder that affects nearly every organ in the body. Which of the following factors cannot contribute to the development of your SLE? Saan mas common ng SLE? Sa babae, sa lalaki? Babae. Yes. Pansinin nyo dito, estrogen, androgen. Ang estrogen, babae. Ang androgen, saan siya most probably predominant? Sa male. Anong tamang sagot? Letter, ano kayang tamang sagot? Letter dog. Okay, letter dog, androgen. Okay, letter dog. 96, a patient is diagnosed with SLE. Which among the following can the nurse tell to the patient as she is being actively management in the ward? Okay. Dito po sa option B mo, ano bang preferred mo? weight-bearing exercises. Okay? Your procainamide is contraindicated sa kanila. Okay, gusto mo ba mag-e-cigarette pa ang SLE? No, kasi possible sila magkaroon ng cancer. Correct answer, letter apple. Letter apple. Kasi prone ba sila maging anemic? Yes or no? Yes. At the same time, nagtitake sila ng methotrexate. Okay? Nagtitake sila ng methotrexate which will deplete your folic acid. Letter apple. Number 97. A nurse is caring for a client with systemic lupus erythematosus, who is taking hydroxychloroquine. The nurse understands that the primary concern of this drug is, ano kaya? Letter C, retinal toxicity. Bakit? Kasi ang tendency niyan pwedeng magkaroon ng blindness. Toxic siya sa retina mo which can lead to your blindness. Letter cat. 98. Patient Mavi is with polyarthralgia with joint swelling and pain, is being evaluated for SLE. There's Olive that the serum test result that is most specific. Okay, most specific is the presence of, ano kayang tamang sagot dyan? Tamang sagot is letter boy. Okay. The anti-SM is an antibody that is found exclusively for your SLE. Okay, your ANA po kasi. Your ANA is a broad. Broad yan, B. Okay? Hindi necessarily mean na meron kang positive for your ANA. Most probably may SLE ka na. Okay? May studies na ganun na. Not necessarily mean kapag ANA yan, autoimmune. Okay? Autoimmune ka. Okay? Autoimmune. So letter boy. Okay? Letter boy. Dali kayo, B. Dali. Evidence-based. Okay? Kadalasan kasi autoimmune yan kapag ganun. Okay. Umasa kayo, umasa. Umasa. Sanay na siguro umasa, B. Sanay na umasa. True? Ganun talaga. Umiyak, huwag mo na umiyak, B. Pag umiyak kayo sa board exam, matutuluan yun. Pag natuluan, lagot kayo. During the acute phase of your dermatomyositis, what is the appropriate patient outcome? Ano kayong tamang sagot? Kapag may dermatomyositis yan, may weak. Okay? May weak neck and pharyngeal muscles. So kapag weak ang pharyngeal muscles mo, anong gagawin mo? Anong gusto mo? Hoy, masaya mag-board exam. Letter boy. Okay, letter boy. Letter boy. Diba? Kasi weak ang kanilang neck and pharyngeal muscles. Letter boy. Alam nyo ba mas mahirap ang after board exam kaysa before the board exam at during the board exam? Mas mahirap ang after boards. Promise. Promise. Yung anxiety levels no, every day, sobrang taas. Yes, the agony of waiting. Promise. Dermatositis is a rare acquired immune-mediated muscle disease. Among GEMA's patients who have suspected your dermatomyositis pala. Correct answer? Letter. Ang common range ito is age of 40 to 50. Common sa women. Tamang sagot. Letter. Boy. Okay, letter boy. Okay, letter boy. Triad of your asthma. Your triad of your asthma is... Wait lang. The triad of your asthma kasi... Wait na, 74. Sige, break with an H. True. Lunch break mo. Ay, bladder break hanggang 3:05. Para matapos tayo on time. Okay. Ano kasi yan, physiologic process. Okay. So, 'di ba kadalasan magkakaroon ka ng inflammation, okay, inflammation tapos mag-i-edema kasi magsa-start yan when it comes to your inflammation. So, magiging hyperactive siya. Ang tendency kapag may inflammation ka, nagiging edematous pa siya. Okay? Your airway tightness is a symptom. Okay? Effect siya ng inflammation at edema mo. Kaya siya nagkakaroon ng airway tightness. Okay? Yung tatlong yon kasi airway inflammation, edema, and airway hyperactivity is ang tawag dito, classical manifestation mo. Okay? Sige, balik ako 3:05. Wait lang. Diyan pa kayo? Diyan pa. Para maaga tayo matapos, Day. Okay. Yung ano, NP3, kamusta NP3? Mas mahirap ba NP3 or hindi? Or mas tolerable siya? Ano, kamusta NP3? Uy, NP3, kamusta? No, it's different. Anti-Smith antibody, specific siya for your ano, SLE. Okay? Specific siya. Your ANA kasi, okay, it indicates na may autoimmune disease ka. Okay, but that doesn't mean na meron kang SLE kapag ANA. Okay? Well, CO done, yes, pero we are focused, kapag ganyan kasi, we are focusing on the ano, evidence-based practice kasi siya. Okay, evidence-based practice. So, ibig sabihin yan, kung ano yung mas recent na documentation, yun yung mas papanigan natin. Okay? O, next. So, yung hirap nito no ano. Next. Carcinogenesis is the formation of cancer whereby normal cells are transformed into cancer cells. This is a component of DNA that can be mutated and is responsible for promoting and regulating the cell cycle. Anong tamang sagot dito? Anong tamang sagot? Sir, hindi ko po alam. Charot. Letter boy. Procto-oncogene. Okay? Procto-oncogene. How about your tumor suppressor genes? Are genes that code for protein products that regulate or slow down? Okay? Or slow down the cell cycle. Letter dog. Okay, letter dog. Next. The laboratory reports that the cells from the patient's tumor is biopsy grade 3. What should the nurse know about the histologic grading? Okay, your option A is a grade 2. Okay, your option B, this is the correct answer, very abnormal and poorly differentiated. Your option C, this is your grade 4. And your option D is your grade 1. Correct answer is letter boy. May tama na? May tama na? Ah, yes. Okay. Tama sa utak, meron na? Meron na. Meron na din, sir. And hindi ko naabutan yung NP3 na panay Harry Potter eh. Hanggang 50 lang yun eh. Your topoisomerase inhibitors is a characteristic of chemotherapeutic agents which induces breaking in the DNA by binding to enzyme topoisomerase, preventing cells from dividing. This is an example of B. Hindi ko talaga to guess. Anong tamang sagot dito? Letter boy. Okay, letter boy. Cell cycle specific S phase. Letter boy. Alam nyo, kahit hindi pa kayo nag-on ko, hindi ito lumalabas sa on ko na lecture na ganyan ka-specific. Okay. Certain chemotherapeutic agents causes toxicity, such as your pulmonary fibrosis, which among the following causes this toxicity. Okay. Kung babalik na rin mo yung letter B, mukha ba siyang lungs? Yes or no? Mukha ba siyang lungs? Hala, sino yung tama sa katabi B? Hala siya. May na-develop ba ditong mag-lab life na? May na-develop mag-lab life. Grabe. Hala, meron nga. Totoo? Eh, di kayo na. Charot. Okay, correct answer is letter dog. Okay. Vincristine, it is for your peripheral neuropathy. Wala pa sa Bataan daw. Bataan, baka naman. Methotrexate is your stomatitis, liver toxicity, and immuno. Pero meron yun yung hindi ko kung naabutan nyo yung February, meron yun dati parang sulit sa top rank kasi meron mga love story na na nilalabas si top rank na na-develop. Okay? Na na-develop sa sa top rank mismo, tapos naging mag-asawa. May mga ganon, promise. Autotoxic. Letter, dog. Sa top rank daw nagkakilala. Ang weird, no? O dali, baka naman daw, meron daw ba dyan? Next, number. O looking for daw po si Ma'am Janine. Nurse Steve is carefully administering the chemotherapeutic agent doxorubicin and consistently monitoring the patient so as to avoid which possible toxicity. Tamang sagot dito kapag doxorubicin, tamang sagot letter C, cardiac toxicity. Okay? Cardiac toxicity. How about your hemorrhagic cystitis? Sinabi to sa Rickles B. Hemorrhagic cystitis, saan to? Anong gamot to? Cyclophosphamide or your Cytoxan. Very good. Cyclophosphamide or Cytoxan. A 41-year-old client with cervical cancer is prescribed paclitaxel, which is a taxane drug. Taxanes are a diverse group of anti-neoplastic agents that interfere with various metabolic actions of the cell. The mechanism of action of your taxane interferes with, tamang sagot, true. O sulit sa top rank, pumasa ka na, nagka-jowa ka na. True. Letter, letter, grabe naman yung nag-top sa jowa. Grabe. Letter apple. Okay, letter apple. Your letter B is cell cycle, S phase specific. Okay, cell cycle S specific. Okay, your C and D is your cell cycle non-specific. Okay, your C and D is your cell cycle non-specific. Next, Nurse Dex is a skilled oncology nurse. She knows that methotrexate is a folic acid antagonist, 5-FU, and cytarabine ay pyrimidine antagonist, and 6-mercaptopurine are purine antagonists. Collectively, they are called as your, ano kaya yan? D, ano yan? Letter boy, anti-metabolites. Letter boy, anti-metabolites. Nurse Hamen-Chis is assigned to the oncology ward in a public tertiary hospital in Manila. The following questions apply. Nurse Hamen-Chis is taking care of 8 years old. Tandaan nyo kapag yung mga ganyan, okay? Kapag below 40, acute or chronic yan. Para mas madali nyo tandaan. Kapag below 40 years old, acute or chronic ang leukemia kanila. Acute. Okay, acute. Kapag more than 40, most probably chronic yan. Okay? Chronic yan. So tanggal mo tong, grabe naman hindi na cute. Kayo ba cute pa kayo, B? O below 40, cute pa ba kayo? Oh. Old cancer patient who was admitted this Monday. He has leukemia wherein there is probably lymphoblast. Okay, pa-cute na lang. Presence in bone marrow, which type of leukemia the patient has. Okay, take note nyo, less than 40, acute, lymphoblast, that is your lymphocytic, letter apple. Okay, letter apple. Number 9, Nurse Hamen-Chis is also taking care of 43-year-old. Kapag 43, acute or chronic, chronic. Okay, he has leukemia where it's mostly granulocyte. Kapag granulocyte, that is your myelogenous. That is your chronic myelogenous leukemia. Letter C. Number 10, Burkitt's. Burkitt's lymphoma is said to be the fastest growing tumor in Burhans. This is developed when the body makes abnormal B lymphocytes. What else does Nurse Hamen-Chis knows about this condition? Tamang sagot, Tamang sagot, letter C. Okay? Type of non-Hodgkin's lymphoma more common in pediatric patients than adult. Okay? Letter C. True. Nurse ham and cheese nose biopsy is the only diagnostic procedure of cancer. The following are not true about biopsy except letter. Okay, letter apple. Okay, letter apple. Yung letter boy mo is a type of your incisional biopsy. Again, your letter boy, one type of your incisional biopsy. Okay? Yung letter C po is ano, you are determining your non-melanoma. Okay? Non-melanoma to. Your letter dog, ay ito pala letter dog, non-melanoma skin cancer. Okay? So letter apple. Apple. Next, Nurse Ham and Cheese gets a chance to assist in a bone marrow aspiration procedure. He is confident about his knowledge and skills about this procedure. In fact, he knows that bone marrow aspiration procedure is everything among the choices, excluding, so maling sagot, tamang sagot. Ano kaya? Tamang sagot, ano kaya? Pwede siya gawing outpatient, yes. Okay. Definite yes. Sternum yes. Okay. Letter apple. Bakit? Yung thrombocytopenia mo kasi not really ano, kumbaga hindi siya contraindicated kasi yung thrombocytopenia mo pwede mo siyang ano ma-address. Okay? Pwede mo siya ma-address. It's like giving your platelet transfusion. Not contraindicated siya. So letter apple. Okay, letter apple. Di ba sobrang tricky na? Kagulat. Okay. Next, cervical cancer is the fourth most common cancer among women worldwide. Primary prevention and screening are by far the most effective modalities for decreasing health care burden and mortality attributable to cervical cancer. HPV is the most common sexually transmitted infection. It's one of the strong risk factors of having cervical cancers. What are the signs and symptoms of your HPV infection? Tamang sagot, letter apple, this is your genital herpes. Okay, genital herpes. Letter C, it is your gonorrhea. Letter dog is your chlamydia. Correct answer, letter boy. Okay, letter boy. Letter boy. Kaya pa? Kaya pa. Number 14. According to the American Cancer Society of Guidelines, what is the recommended schedule of your pap smear for the patient Zoe, female, age 23? Tamang sagot. May class pa ba kayo after nito? May class pa kayo after? Wala. Letter apple. Zoe should start having pap smear alone every 3 years. Letter apple. Ayaw nyo nang pahinga kayo after. Masakit ba sa ulo ang... Tapos bukas yung ano nyo, pre-boards 1 second half. Bukas. Or tapos na. Bukas. Nurse Pepperoni advises patient Zoe about the things that should be done before pap smear. Zoe needs further instruction when she states which of the following. Okay, tamang sagot. Letter. Okay, tamang sagot ito. Letter dog. Maling sagot. Kasi bakit? Your pap test can be done during a pelvic exam. Okay? But sometimes a pelvic exam is not done without a pap test. Okay? Okay, pa-mute daw nung... Mute natin siya. Yan. Again, ang pap test, ginagawa siya during the pelvic exam, but sometimes pelvic exam is done without a pap test. Letter dog. Letter dog. Lithotomy is the position of choice for a hysterectomy procedure to manage cervical cancer. However, one of the potential complications of your prolonged surgery in lithotomy position is cuff compartment syndrome. Nurse Pepperoni clearly explains to the patient about compartment syndrome. Anong tamang sagot dito? Ito, letter apple, this should be is due to your venous obstruction. Okay? Venous obstruction. It's developed during prolonged surgical procedure for more than 5 hours. Okay? More than 5 hours. The anterior, not posterior, the anterior compartment of the leg is the most common location. Tamang sagot, letter cat. Okay? Letter cat. Okay, letter cat. Ganun ba ginagawa niyo? Pag mahaba na, yun na yung ano, yun na yung sagot pag mahaba. Next. Pag wala ng time. Nurse Pepperoni is assigned to Sir Box, patient with prostate cancer. Prostate cancer is slow-growing type of malignancy that is mostly diagnosed among older men. What is the function of your prostate gland? Letter B, this is for your testes. Okay, letter C is for your vas deferens. And your letter D is for your epididymis. Correct answer is letter apple. Create the seminal fluid and mixes with the sperm. Apple. Okay, letter apple. Okay, letter apple. On number 18. The following do not increase the prostate antigen levels of the men except, anong inaano mo yung nakakataas ng prostate antigen level? Ano kaya nakakataas ng prostate antigen level dito? Tamang sagot, letter. Pili nyo, ano kaya ang tamang sagot dito? Ano yung nakakataas ng prostate antigen level dito? Kasi di ba, opposite, ano to? Double negative answer. Tamang sagot, uy, hala, sinundo naman sila. Tamang sagot, ano kaya? Hula. Letter, magugulat kayo, letter apple, riding a bicycle. Okay, riding a bicycle, some studies have suggested that cycling may raise your PSA levels for a short time. Letter apple. Letter apple. Yes. Diba? Nagulat din ako. Yun pala yun. RIP ang tooth. Okay? Which could be a complication of your cryotherapy surgery for a prostate cancer. Tamang sagot, letter, ano? A patient could have ejaculate difficulties and be impotent. Ang tendency nito, ano, kapag meron kang tumor growth or obstruction kasi to. Okay. Correct answer is cryotherapy, bone marrow, wala pa to. X mo si letter C. Okay, tamang sagot is letter apple. The urethra could become scarred and cause retention. Letter apple. Cryotherapy surgery ka pa lang. Okay, cryotherapy surgery ka pa lang. Nurse Pepperoni was reading literature about different prostatectomy procedure. Which of the following refers to the suprapubic prostatectomy? Her letter apple, this is your transurethral resection. Transurethral resection. Or your TURP. Okay, correct answer is letter boy. Letter boy. How about your letter C? This is your suprapubic. Suprapubic prostatectomy. Your letter dog, this is your retroperitoneal retropubic prostatectomy. Retropubic prostatectomy. Tamang sagot, letter boy. Opo, suprapubic. Ay, charot. Ito pala, sorry. Mali. Charot. Ito, this is your perineal, perineal prostatectomy. Yan, sorry na. Yan. Anong kadalasan kapag nag-prostatectomy yung patient? Anong kadalasan expected mong intervention? Ano mang pagka-receive mo kay patient, anong ginagawa sa kanya? Yan, nakapag-TERP. Pag TERP yan, expected mo ba naka-cystocytosis yung mga yan? Yes or no? Yes. Expect mo naka-cystocytosis si patient. Next. Sir Boss undergoes your retropubic prostatectomy. What does Nurse Pepperoni knows about this procedure? Tamang sagot, letter dog. Removal of the prostate gland by low abdominal incision without opening the bladder. Letter dog. Hmm. 22. The cremasteric reflex is absent in which problem of the scrotum and the testes? Tamang sagot. Ano yung varicose? Your varicose is dilatation of the veins. Yan. Ang hydrocele may scrotal lymphedema. Scroma. Correct answer, letter dog. Okay, letter dog. Okay, letter dog. Letter dog. Sige, sabi sa akin kapag done na. Done. Next. Serum tumor markers that may develop on diagnosis of your testicular cancer and used to monitor the response to therapy include. Anong tamang sagot dito? Ano kayong tamang sagot dito? Letters. No. Your letter C is for what? Ano kayong letter C mo? PSA is for your prostate cancer. Prostate cancer yan. B. Testicular cancer tayo. Diba? Your CAR-CA belongs to your what? GI cancer. Okay? GI cancer. Yung ANA, sensitive for your autoimmune. Autoimmune. Okay? Ang iyong C-reactive protein reflects your inflammation. Okay? Inflammation po yan. Okay? Ito, TNF, your tumor, tumor surveillance. Tamang sagot, letter boy. Alpha-fetoprotein and your human chorionic gonadotropin, which is elevated in your testicular cancer. Letter boy. Nahuli kayo sa prostate, no? Sure. Diba? Na ano kayo sa prostate? Yun lang din ang alam. Okay? Next. Delete na in 3, 2, 1. Sorry na. Nurse Milty is another nurse assigned at the oncology ward. Handling a patient with bladder cancer. Urinary diversion may be performed with or without cystectomy as a management of bladder cancer. This is a type of your urinary diversion where it diverts urine into surgically created pocket that function as a bladder. The stoma is continent and the client removes urine by regular self-catheterization. Anong tamang sagot dito, B? Letter, letter dog. Ileal reservoir. Ileal reservoir. 25. The following does not talk about cock pouch as urinary diversion except B, hindi ko rin ito mag-gets B. Okay, your letter apple is your ileal conduit. Your letter C and D is your ureterosos. And your letter tamang sagot is letter boy. Letter boy. Okay, letter boy. Kaya pa, B? Kaya pa? Kaya pa? Or di na makarelate? Nakarelate pa sa topic. Next. Can't relate, sir. Next, infrafrontal tumor is not tamang sagot. Not located in the cerebrum. Kasi located siya ng cerebellum. Letter dog. Okay, letter dog. Ilang points sa mga people? Ilan points sa mga people? 1, halos. True. 2. Okay. This is the most common brain tumor of childhood. Slow growing and can cause seizure, head nausea, and headaches. Tamang sagot. Ang pinaka-common dyan is what? Saan kaya dyan yung parang merong star? Saan kaya dyan yung parang may star? Di ba yung mga bata mahilig sa star? Mahilig sa astronaut. Tamang sagot. Pag desperado ka na, dapat ganun ka na, B. Letter C. Cerebellar astrocytoma. Di ba? Letter C. Kasi may astronaut yan, B. Di ba? Context clues ka na dyan. Next. These are the immune cells of the central nervous system. They move around within the brain and constantly communicate with other cell of the same type. Tamang sagot dito, B. Letter. Nga, i-comfort mo kasi. Letter boy. Microglia. A special type of glial cells known as your, yan siya. Okay? B, hindi ko din mag-gets siya. Ang hirap niya i-gets. Okay? How about your astrocytes? Ang astrocyte mo kasi star-shaped cells that surrounds the neuron and support the neuron function. Yan siya. Yan. Oligodendrocyte mo ito. Hindi ito. Yan ang dyan. Your glial cell, ito siya. Wait, sulat natin. Yan. Yan. Barbie, naisip mo hindi star. Next. Sige, copy nyo na lang yan. Next, number 29. Nurse Bo Peep takes care of children with cancer. She knows that retinoblastoma can be acquired genetically in... Tamang sagot dyan. Common po ba? Common ba ang retinoblastoma? Yes. Okay, ano yung pinaka-common kaya dito? Ano yung pinaka-common? Letter boy. Autosomal dominant. Okay, autosomal dominant. 30, an allogenic hematopoietic stem cell transplant is considered as a treatment for a patient with acute myelogenous leukemia. What information should the nurse include when teaching the patient about this procedure? Anong tamang sagot kaya dito? Letter, tama, letter C. Peripheral stem cells are obtained from donor who has a human leukocyte antigen match with the patient. Letter C. Next, during the initial chemotherapy, a patient with leukemia develops hyperkalemia and hyperuricemia. The nurse recognizes these symptoms as an oncologic emergency and anticipates that the priority treatment will be to, tamang sagot dito. O, kapag ganyan, okay, kapag ganito, priority treatment, it's just something to do with the active management. Okay, active management. Kapag nag-acquire ka ng ECG, ano mangyayari? Pag nag-establish ka ng ECG, ano mangyayari? Wala. Okay? A and B are opposing answers. Pansinin mo, increase urine output, restrict fluids. Tamang sagot. Anong gusto mo? Letter na kaya? Letter apple. I-dilute mo yung hyperkalemia mo, pati uricemia. Paano ba na-excrete ang potassium? Pwede ba siya ma-secrete sa, sa wiwi? Yes. So, letter apple. Letter apple. Bakit may pambihira ka dyan? Okay. 30C. Student nurse Purple is reviewing concepts on immunology. The following questions apply. Patients with dermatomyositis are diagnosed according to this criteria. O, di ba si dermatomyositis, di ba? Age onset to kadalasan 40 to 50 years. Pattern of muscle weakness, saan ba siya may weakness kadalasan? Kadalasan ang weakness nito ay sa neck muscles and the presence of your skin manifestation. Tamang sagot, letter boy. Letter boy. Letter boy. Number 33. During assessment of the patient with fibromyalgia, what should the nurse expect a patient to report? Okay. Tamang sagot dito. Kapag fibromyalgia yan, mag-expect ka ba ng muscle twitching? No. Okay? Walang muscle twitching to be. Okay? Muscle weakness, wala din. Ano bang kadalasan mo kapag no. Okay, hindi rin to. Hindi ka rin muscle weakness, masakit lang siya. Pero hindi ka po nilalagnat. Correct answer, letter boy. Letter boy. Okay, letter boy. Ano ba yung classical manifestations mo? Your fibromyalgia can include your muscle pain, brain fog, fatigue, face and jaw pain, headaches and migraines, bladder control issues, digestive problems, memory problems, anxiety and depression, and your insomnia. Okay, kadalasan yan muscle pain. So anong tamang sagot sa number 34? What is the one criterion identified by American College of Rheumatology for diagnosis of your fibromyalgia? Tamang sagot. Ano kayang possible tamang sagot? Yan, may naka-iPad siya. Tamang sagot, letter 33 po is letter boy. Tamang sagot, letter dog. Letter dog. Okay, the elicitation of pain on palpation of at least 11 of 18 identified tender joints. Letter dog. O B, ito 35. What is most likely to cause the pain experienced in the later stages of your OA? Osteoporosis, osteoarthritis. O, anong tamang sagot dito, B? Bakit daw sumasakit? Tamang sagot sa number 35. Pag nagkamali, batok. Tamang sagot. Tamang sagot. Letter dog. Okay, letter dog. Bone surfaces rubbing together. Letter dog. Okay, batok. Next. A patient with OA asked the nurse whether he could try glucosamine and chondroitin to control of his symptoms. The best response of the nurse includes what information? Ano kaya? Pinaka-safest answer mo dyan? Letter apple. Okay? Some patients may find these supplements helpful for relieving arthritis, pain, and improving mobility. Letter apple. Letter apple. A patient taking ibuprofen. Ay, ibuprofen mo ba? Map, di ba sa tiyan ng ibuprofen, yes or no? Map, di ba sa tiyan ng ibuprofen, yes or no? Ibuprofen, map, di sa tiyan? Yes. Okay? For treatment of OAS, good pain relief but experiencing dyspepsia and nausea with drugs used. The nurse consult the primary care provider about doing what? Tamang sagot. Letter. Okay? Tamang sagot is letter apple. Okay? Bakit apple? Okay? Your misoprostol or Cytotec is used to prevent NSAID-induced gastric ulcer and gastritis and would increase the patient's tolerance of any NSAIDs. Okay? Letter dog. Okay? Letter dog. Ay, letter apple. Sorry. Letter apple. Lutang na ang person. Pagod na. Apple, apple. Apple. Next. During a physical assessment of the patient with early to moderate RA, what should the nurse expect to find? Tamang sagot dito. Letter. Ano kaya? Saan ba yung crepitus? RA o A? Tamang sagot, OA yung crepitus mo. OA yun. Opo. Okay? Ang Heberden's node mo, OA din. OA. Tamang sagot, letter C. Spindle-shaped fingers. Bakit? Kasi meron kang synovial hypertrophy. Okay, and thickening of the joint capsule. Letter C. Okay, letter C. Laboratory findings that nurse would expect to be present in the patient with RA include, tamang sagot dito. Ano kayong pinakatamang sagot dito? Okay. Kapag may RA ka, yung IgG mo, normal. Ang WBC mo, pwedeng mag-expect ka na increased. Tamang sagot, letter, dog. Okay. Letter dog. Synovial joint. Letter dog. 40. Which of the following extra-articular manifestation of RA is most likely to be seen in a patient with rheumatoid nodules? Ano kaya yan? It's your letter C. Letter boy. Felty syndrome. Okay, Felty syndrome is the most common in patients with severe nodule forming RA. Okay? Hindi ko kasi alam kung paano basahin to. Sjögren's. Occurs as this by itself if with arthritic disorders. Okay? Letter boy. Okay? Okay, letter boy. Ano ba yung Felty syndrome? Ang Felty syndrome mo, splenomegaly, anemia, neutropenia, thrombocytopenia, and your arthritis. Okay? Letter boy. Letter boy. Hindi ako gumawa nito. Inaano ko lang yung sagot B. Okay, next. 41. Or which drug that prevents binding of tumor necrosis factor and inhibits the inflammatory response? Hindi ko alam. Hanapin ko sa inyo. Used to the management of your RA. Tamang sagot dito. Tamang sagot. Ano kayang tamang sagot dito? Letter. Sawa na sa letter C. Di ba? Sawa na kayo sa letter C. Sawa na din sa letter D. O, pili na lang kayo dyan. Letter boy. Entanercept. Or Enbrel. Hindi ko din. Alam niyo yung kung ano yun, B? Alam niyo yun? Hindi ko din alam yun. Letter boy. Letter boy. Letter boy. True. Oh, the patient has had RA for some time but had not success with previous medication. Also, there's an increased risk for tuberculosis, which monoclonal antibody is used with methotrexate to best treat symptoms. Ano ang tamang sagot dito? Okay, tamang sagot. O, sawa na tayo sa letter C and D. Diba? Sawa na tayo sa letter C and D. Letter, ayaw mo ng gold, B. Mahal ang parenteral gold. So, letter boy. Letter boy. Certolizumab. Okay, certolizumab. Tama kayo. Ito yung mga, sir, ako promise, hindi lalabas sa board exam yung ganitong gamutan. Oh. The nurse teaches the patient with RA that which exercise is one of the most effective methods of your aerobic exercise. O, anong tamang sagot dito? Tamang sagot, letter C, aquatic exercises. Kasi dahan-dahan siya. Okay, dahan-dahan siya. Natatawa ako sa memes na, sorry. Wait lang, baka tumawa ako ng malakas. Number 44. A patient seen at the outpatient clinic for sudden onset of inflammation and severe pain in the grade. So, a definitive diagnosis of gouty arthritis is made on what basis? Tamang sagot dito. Anong tamang sagot? Tamang sagot, letter, dog. Presence of your monosodium urate crystals in your synovial fluid. Okay, letter, dog. Sir, siguro pag pinikit ko na lang mata ko, tas nang hula ako sa NP3, mas mataas pa score ko. True. Charot. Joke lang. Number 45. The spondyloarthropathies are another category of systemic inflammatory disorders of the skeleton. This includes the following except, tamang sagot, ito siya. Anong tamang sagot dyan, B? May nakatama, letter. Apple. Okay, letter apple. Tama kaya? Tama. Ito siya. The spondyloarthropathies include ankylosing spondylitis, reactive arthritis, also known as Retter's syndrome, and psoriatic arthritis. Letter, apple. 45. Nurse Gemma is preparing medication for a patient with spondyloarthropathy. Which of the following is prescribed requires further referral to the physician? Okay, so syempre, NSAIDs, diba? NSAIDs, first line mo to. Okay? Your methotrexate and your sulfasalazine, pwede din to. Okay? Tamang sagot, letter C. Bakit? Ang possibility kasi nito, pwede ka magkaroon ng psoriatic. Okay, psoriatic skin flare. Skin flare. Tamang sagot, letter cat. 45 po is letter apple. 44 po is letter dog. Hindi, sa Mars ata galing, hindi ata sa Neptune B. No, sa Mars ata galing. Hindi ko din alam saan nila nakuha yung mga, basta hindi ako yung promise. Tapos na yung questions ko dito. Okay. Number 47. An important nursing diagnosis for the patient with ankylosing spondylitis is to teach the patient to do what? Anong tamang sagot dito? B, pinakagusto mong intervention saan dyan? B, ano yung pinakagusto mong intervention? Palagi mo tong ini-include letter, letter dog. Ano bang favorite niyo? Deep breathing exercises. Letter dog. Okay, letter dog. Next, Nurse Jamie is assigned to a patient with ankylosing spondylitis. Which of the following is not a true statement? Okay, tamang sagot dito, people with ankylosing spondylitis usually present with what? Kyphosis posture. Kyphosis posture, letter apple. Kyphosis posture kasi siya. O itinry ko na yung last boards. Kumuha ko ng exam question sa physician licensure exam. Last season. Parang, make sure kung yun, pero last season, yun ngayong season kasi medyo naging mabait ako. Ito hindi ko sure kung ito yun. Hindi ko sure. Pero last season, pang PLE yung ginawa ko. Ngayon, hindi, mabait tayo ngayon. Mabait ako ngayon. So, medyo dinali ako exam. These are non-extraskeletal affectation of your ankylosing spondylitis except, kaya? Letter apple. Upper lung fibrosis. Okay, upper lung fibrosis. Letter apple. Number 50. Which descriptions are related to reactive arthritis? Okay. Your reactive arthritis. Anong tamang sagot dito? Pag tama, magaling. Anong tamang sagot dyan? Tamang sagot, number 50. Siyempre, hindi na letter B. Paulit ulit tayo letter B. Diba? Paulit ulit yung letter B. So, hindi na yung sasagutin. Okay? Reactive arthritis is self-limiting and follows GI or sexually transmitted infection. Okay? Letter dog. Okay, letter dog. Sa Diyos na lang nyo iasa. Okay? Letter dog. Dog. Okay, ano score niya? 1 to 50? Okay, questions. Hindi na ako hanggang 50, hanggang 50 lang ako, B. Questions. Yes naman, may naka 48 daw. Charot, 48 na mali. Questions. Tingin ng pre-boards to, hoy. Hindi pwede. Pero sabi ako nag-aano sa inyo, mas madali ang pre-boards to. Questions. Questions. Expect nyo, to be honest, hindi talaga ganyan ang hindi po ganyan kahirap ang board exam, 'di ba? Ano ba sabi ko sa inyo, 'di ba? Ang sabi ko sa inyo, your pre-boards one is parang sampal sa mukha siya kadalasan na parang hindi pa yung mga nagchi-chill ganyan, 'di ba? At the same time para matuto kayo kung paano mag-context clues pag hindi mo talaga alam kung ano yung sagot. Okay? Question, happy ba ako sa ginawa ko? Well, expected ko kasi talaga na magagalit yung students. Expected ko na isusumpa kami ng students. Okay, happy ba ako sa ginawa ko? Hindi ko sure. Okay. Masaya naman gumawa ng question na ganyan. Ilan ako nung pre-boards 1 noong time ko. Magaling kasi manghula ang person. Nasa yung score ko? 330 something. Pre-boards 1. Oo, B, magaling manghula ang person. Magaling maghula tsaka context clues kasi ang person. Ayoko na madaling exam. Gusto ko mahirap na exam. Yeah. A question pa. Yeah, mas it would depend kasi. It would depend kung mas ma-motivate kayo. Pero sana mas motivate kayo mag-aral. Mas pag-igihan yung pag-aaral nyo. Okay? Kasi at this point in time, baka kasi nagiging relaxed na yung mga tao. Diba? baka mas maging relax kasi yung mga tao kasi parang, ay ano na to, ang tawag dito, parang, ay, palagi naman ako mataas sa recalls ko eh. Parang ganun. Palagi naman ganyan-ganyan sa recalls ko. Parang, at the same time, para magkaroon kayo ng downfall. Kumbaga, para magkaroon kayo ng, ay shit, hindi ko pa pala alam lahat. Parang ganun. Parang ganun yung goal kasi ng pre-boards 1. Huwag naman ma-depress, di ba? Kakayanin yan, kahit sabihin nyo retaker, I'll be proud yung mga retaker. Sobrang lalakas ng loob ng mga retaker. O question pa. Diba? Mas talaga, mas manggigigil talaga kayo. At the same time, para nag-improve yung scores ng pre-boards 2. Diba? Diba? Mas mag-improve yung scores mo sa pre-boards 2. Diba? Trust the process, sabi nga. Totoo naman. Scores actually your pre-boards 1 kasi it's relatively really hard talaga siya ng exam. So wala akong sinasabi kada sa mga students na dapat ganito scores mo kasi ang hirap talaga niya. Mahirap talaga ang pre-boards 1. Yung tipong kung dumudugo ilong, dugun-dugo talaga ilong nyo. As in, hemorrhagic stroke na. Hemorrhage na talaga yung levels. 'Di ba? So expected talaga. Questions pa. I'll entertain questions para lang Thank you. Basic lang do. Ay, matalino yan. Isang araw lang ba yung boards? Isang araw lang boards nyo. Pre-boards. Well, tinitrain kasi din kayo para Oo, joke lang. Ano ka ba? I don't take it seriously. Mga questions. Questions pa. Nakaka-pressure yung time kasi talaga naman sa board exam, may mga mabibilis talaga magsagot. Ako nagsasabi sa inyo, may mabibilis sumagot sa board exam. Promise. Yes, kasi your board exam is relatively, meron kasi may mga hindi nagtatap talaga sa recalls and pre-boards kasi your board exam, di mo kasi alam kung ano lalabas sa board exam eh. 'Di ba? May certain ang tawag ito, may certain theme ang for board exam. Okay, may certain theme yan. For example, ang theme pala ng board exam nyo, malay nyo, pediatrics pala. 'Di ba? Malay nyo, ang theme ng board exam nyo, IMCI pala, 1 to 100. Malay nyo, ang theme ng board exam nyo, SATA, select all that applies, 1 to 100. Depende kasi talaga yan. Okay, it would depend talaga. Mas madali pre-boards or board exam. Relatively kasi, ang word kasi na madali, depende kasi sa student yan. Okay, depende kasi sa student yan. May nagsasabi mas madali ang pre-boards, may nagsasabi mas madali ang board exam. Pero sa akin kasi mas nadalian ako sa board exam. Okay? Questions pa? Questions pa? Ano to? Thank you so much. Sana may natutunan kayo as much as possible. I tried my best na may mabigay ako sa inyo. Okay, sana meron ako na impart na knowledge sa'yo kahit sobrang hirap ng topic. Oh, hi daw, Paking. Sino si Paking? Meron, sir, sakit sa puso. True. Questions? Mas madami tawa kaysa tinama. True. Questions? I'll entertain questions. 3 hanggang 4. Natutunan pala sama ng loob. Thank you din. Thank you. Ano pong pre-boards to? Expect nyo pre-boards to relatively para siyang reality ng board exam. Okay, ito yung pre-boards 2. Kita natin. Charot. Ayaw lumit eh. Ayaw lumito. Ayaw lumit. Ay, lagyan. Silip lang. Silip. Wait lang. Ay, nag-end slideshow na tayo. Ayaw eh. Ayaw lumiit. Oh. Ayan, lumiit na siya. Ayan. On. Aralin niyo yan. Yan yung inaaral ko. 'Di ba? Oh, nakita niyo na. Kaya inaaral ko ngayon. Oh, kita niyo na. Ayan, pre-boards 2. Pre-boards 2. Oo. Pre-boards 2. Ito yung inaaral ko. Stop share na. Alis na ako. Bye-bye. Bye-bye. Pag may mga tanong, tanong lang. Pag may tanong, go lang ha. Thank you so much. Bye-bye. Pansinin ko daw si Sheila Paking. Sheila Paking. Okay, Sheila Paking. Paking? Pa-follow up daw po si Al. Sino si Al? Message ako kung gusto niyo magpa-follow up sa Instagram. Nagpa-follow back ako sa Instagram. Message lang. Okay, bye-bye. Thank you.